but the dreams I've seen lately keep turning out and burning out and turning out.
Three knock. Knock three times if you love. What other song?
Yeah, you got it.
We all heard that song.
You know that song, right? Okay. Good morning, everyone. It's the three knock, George. It's the three knocks, okay? All right. Well, we've made it to day 3 unscathed, everyone, and excited today as we continue on the process of board priorities. And so I think everyone has the agenda in front of them, and this will be a great time to bang these out, and looking forward to another great discussion. Madam Manager, I don't know if there's anything you want to tee up?
I do not. I think we're just ready to get into it. We're going to start with Adrian Cox and Michael Griswold, who are going to spend a considerable amount of time going through all of your priorities since 2018. We're going to show you how much money you've spent on every priority, and we're going to show you all the outcome and performance data that we have for those priorities, and that should really help you as you move into the priority setting process.
Thank you.
All right, thank you, County Manager. Good morning, everyone. As you know, later today, the board is going to have an opportunity to set their budget priorities. So, as the manager mentioned, this morning, Michael Griswold and I are going to review the accomplishments that have been made and continue to be made by the county aligned to the board's 6 priorities. I'm going to share with you a timeline for each of the board's priorities and highlight the major investments that you have made. With each priority, Michael will then go over some of the results that have been accomplished. Also, as the manager alluded to, we have made lots of investments, and so this presentation is a bit longer, but if you hang with me, I believe this will provide a history and some foundation for the rest of your discussions today. So, as a reminder, here are the board's 6 priorities and racial disparities as a cross-cutting focus that intersects with all of the priorities. These were last reviewed by the board at the retreat in fiscal year 2024. We'll begin with early childhood development. For this priority, I'm going to start in fiscal year 2018. 2018 was an important milestone for the county. This year, the county added $6 million of county funding to expand the federal child care subsidy. This investment allowed for 880 children to attend an early childhood program and eliminated the wait list for 4 to 5-year-olds. Prior to this investment, most of the county funding for child development focused on K through 12. Then in fiscal year 2019, Mecklenburg County initiated MEC Pre-K with an $8.7 million investment, which created 33 new pre-K classes to serve 600 children. This represented the first step to make MEC Pre-K available to all 4-year-olds. Also in 2019, the county invested $700,000 to begin child care subsidies for the children of parents enrolled in our workforce development programs. Then at the annual retreat in January 2019, in preparation for fiscal year 2020, the board approved a set of budget priorities to guide budget investments. Funding MEC Pre-K was identified as one of those priorities. The fiscal year 2020 budget added $21.1 million to continue supporting early childhood education initiatives. This included $14 million dedicated to help clear the child care subsidy wait list, serving 1,500 children from birth to 5, and $7 million allowed us to open 36 new MEC Pre-K classes, bringing the total number of classrooms to 69 and the total number of children served to 1,242. In 2021, $5.5 million of new funding for MEC Pre-K brought the total investment to $21.3 million a year and expanded capacity by 365 additional students for a total of 1,602. However, that year COVID-19 began to hit the county and classroom capacity was lowered to 50% as a precautionary measure. This capped the available seats that year to 801. Despite the impacts of the pandemic, the MEC Pre-K program opened additional 20 classrooms, which brought the total number of classrooms to 89. The board revised the priority to expand MEC Pre-K at the 2022 retreat. In 2022, we increased funding by $2 million to add 16 classrooms, bringing the total number to 105, with the capacity to serve up to 1,890 students. That year, restrictions from the pandemic began to lift, and the program served 1,630 children, filling over 86% of the available seats. Also, the county's round one of ARPA funding provided $3 million to a variety of partners working to support early childhood development. In 2023, total funding for MEC Pre-K was $23 million, with 105 classrooms serving 1,890 children. The county increased the monthly reimbursement rate from $838 per child per month to $880. By the end of the year, we had filled 95% of the available seats, and 95% of the teaching positions were also filled. Our round two ARPA allocation made that year provided $4.3 million to community partners supporting early childhood development. At our 2024 retreat, the board revised the priority of expand MEC Pre-K to what is today early childhood development, which encompasses health as well as educational development for ages birth to 5. In fiscal year 2024, we increased funding by another $1.1 million to support NC Pre-K, which brought the total per child per month funding to $900 for both MEC Pre-K and NC Pre-K. Last year, MEC Pre-K hit an all-time high enrollment of 1,814 students, or 97% capacity, and staffing rates for teachers remained above 97% through the school year. $354,000 funded a project manager and consultant to develop a prenatal to 5 strategic plan, and $492,000 of federal funding was used to address demand for WIC services. For this year, $592,000 increased the total per child per month funding to $925 for both MEC Pre-K and NC Pre-K. And $394,000 was used to increase the number of subsidies for families participating in county workforce development programs for foster care. We currently provide subsidies to 82 children participating in county workforce development programs, and we are working to set up the foster care subsidies. Earlier this year, the county also collaborated with child care partners to develop an expedited child care search for foster families, and staff are being trained on this new process. So from fiscal year 2018 through fiscal year 2025, the county has made $288 million of new investments in early childhood development. This includes ongoing annual increases, which are shown in the left section of this table, that total to $46.5 million each year and continue into future budgets. There was $7.3 million of ARPA funding. You can see the total annual amounts here in this table, and the cumulative total includes the accumulation of ongoing increases, and together with the ARPA funding, by the end of fiscal year 2025, the county will have invested $288 million over 8 years. So at this moment, Mike's going to come up and talk about some of the performance metrics.
Thanks, Adrian. Good morning, Commissioners. As Adrian mentioned, my portion of this joint presentation will include discussion of performance results for each priority area, and we'll begin with early childhood development. So public pre-K enrollment has increased each year following the pandemic and hit another all-time high in 2024 at just over 6,200 children enrolled. MEC Pre-K had enrollment of over 1,800 children and 99% of available seats filled. When we look at the Census Bureau data and state population data, we see that there are approximately 14,500 4-year-olds each year in Mecklenburg County, and that means that in 2025, we estimate that about 43% of the 4-year-olds in Mecklenburg County were enrolled in public pre-K. However, this is likely an underestimate of the impact, given that there are going to be some children in the county who will not enroll in public pre-K or public school in general. So when we think about the percentage of 4-year-olds that we could actually reach with public pre-K, it's likely greater than this 43% total. MEC Pre-K kindergarten readiness benchmarks in 2024 are largely consistent with prior years. Since the onset of COVID-19, MEC Pre-K has continued to see some downward trends in development in the cognitive domain with each successive class of students. The program is continuing to monitor this as an area of focus to identify opportunities for better supporting student growth. And just for your awareness, the cognitive domain includes objectives such as demonstrating positive approaches to learning, remembering and connecting experiences, and using classification skills. Additionally, MEC Pre-K continued to emphasize language and literacy development in the classroom and through professional development, helping students to continue to reach elevated rates of kindergarten readiness in 2024 when compared to recent years. The math domain, while increasing, continues to be the lowest scoring area.
Can you speak just a little bit louder?
Yes, ma'am, I can. So the math domain, while it is increasing, continues to be the lowest scoring area. To promote wider development of early math skills, MEC Pre-K continues to integrate mathematical thinking and concepts into all classroom studies and activities. Outside experts have been brought in for professional development for teachers to remove the fear of teaching math concepts and practice innovative ways to weave math-centric activities and vocabulary into everyday routines instead of strictly relying on specific set-aside time for math learning. This slide again shows the same TS Gold assessment as on the previous slide, but instead of comparing overall readiness by domain across years, this slide shows 2024 readiness by domain across race and ethnicity groups. Disparities across MEC Pre-K students' demographics have steadily decreased, though not consistently across all domains. For example, from 2023 to 2024, the gap between the highest and lowest performing groups improved in the social emotional, cognitive, language, and math domains, while this gap increased in the physical and literacy domains. Despite these varied results across the multiple domains, the overall trend is that the disparities are decreasing. We also see a general trend of reducing the black and white achievement gap across the years, though any one comparison of a single year should be treated with caution and viewed over the long term. Additionally, county staff are working to identify opportunities to better understand developmental outcomes and any potential disparities for NC Pre-K as well as Bright Beginnings. Understanding similar outcomes for these other programs would help the county to further understand and contextualize the impact that MEC Pre-K is having on students. MEC Pre-K students demonstrated significant overall growth on the Brigance Early Childhood Screener during the 2024 school year. The Brigance Early Childhood Screener evaluates key predictors of school success across several developmental domains. It allows for comparison of performance to the cutoff scores for delays and giftedness, the performance of same-age children, and the child's actual age versus developmental age. On the left side of the screen, you can see a comparison of the chronological or actual age versus the developmental age of students. In the pre-screen, we can see that there is an average of an 8-month gap between the actual and developmental age of the MEC Pre-K students. And at the end of the school year, however, the post-screen shows less than a 2-month gap in these same students. This demonstrates the positive developmental impact and improvement that MEC Pre-K students experience in the program. On the right side of the screen, we can see a different view of that same pre- and post-screen data. It shows the percentage of students who are demonstrating developmental delays, those who are within the normal limits, and those who are above the gifted cutoff point. In the pre-screen, we see that 58% of students are within the normal range or above gifted, whereas this rises to 78% in the post-screen, demonstrating that not only are we reducing the actual to developmental age gap, but that this reduction is resulting in substantially more students performing in the normal and gifted range. These 2024 developmental growth scores are consistent with last year and demonstrate consistent positive outcomes in our MEC Pre-K programming. Finally, the county's investments have significantly increased access to child care and provided support to county's program participants. On the left side of the screen, we see a breakdown of the average number of children per month who are utilizing a subsidy voucher. The gray bar represents the state-funded programs, whereas the teal bar represents the county-funded programs. We can see that the number of state-funded children has remained relatively consistent when comparing 2021 to the most recent data in 25. However, there's been a 200% increase in the county-funded children. This increase is a result of the county's continued investment and support of these subsidy programs, and we're seeing significantly increased access to child care as a result. On the right side, we can see a breakdown of the 2025 county-funded participants and the programs that they are supported by. The county's expanded eligibility programming and MEC Pre-K represents 93% of the 2025 total. However, we are also seeing year-over-year growth in the number of children utilizing a workforce development voucher each month, with an average of 31 children per month in 2022 and 72 children per month in 2025, which is a 132% increase in 4 years. Overall, in the early childhood development space, we are seeing continued positive impact from the county's investments across these various metrics. I'll hand it back to Adrian.
All right, now I'm going to go over the budget timeline for the educational attainment priority. And I'm going to start in 2022 because at the annual retreat in fiscal year 2022, the board first identified educational attainment gaps as a budget priority with an emphasis on linking funding decisions to educational outcomes. Following the budget adoption, the county and the Board of Education entered into dispute mediation and reached an agreement to move forward in a spirit of cooperation and ongoing commitment. In final budget for fiscal year 2024, funding for CMS operating was increased by $17.2 million, or 3.3%, to a total of $538 million. That year, the Board of County Commissioners and the Board of Education met jointly to discuss the student outcomes-focused governance model being implemented by CMS, and CMS updated its school improvement plans and made the plans accessible on the district's website. In 2023, funding for CMS operating was increased by $20 million, or 3.7%. The funding included English learner support and funding for the PACE Global Academy to help immigrant families. The county provided additional one-time funding for maintenance for a total of $33 million. The county also supported the Sullenberger Aviation Museum, focusing on STEM education with a $3 million capital allocation. The museum opened to the public on June 1st, 2024. Outteach was awarded a community service grant to install 3 learning labs, and a new $55,000 community service grant to Gen 1 provided advising to 225 students and helped 15 first-generation college students receive financial aid or scholarships. At the board's annual retreat in 2024, the board changed the priority, reducing educational attainment gaps, to educational attainment, expanding the focus to funding strategies that improve college and career readiness. Funding for CMS operating was increased by $39 million, or 7%, to a total of $597 million that year. The county provided $1.7 million to the library as a one-time allocation to fund additional books and digital resources. Enhancements for the library also included $147,000 to hire a business analyst and HR coordinator, and $109,000 in additional programming to serve 53,000 more attendees. And in 2024, a $100,000 community service grant for the Torch Fellows program provided advising to 250 students and helped 56 first-generation students apply for college. This year, the county increased funding for CMS by $46.4 million, a 7.8% increase for a total of $643 million. This funding is being used to increase salaries and benefits, including the first step in the strategy to reach the $20 per hour minimum increase and supplements by an average of 5%. As I mentioned the other day, the state salary increase for teachers was 3%, which is lower than the 4.5% increase included in the budget for the local share, and therefore the additional funds will be applied to reaching the goal of $20 per hour minimum. County funding has also been used to hire 15 new maintenance positions and will provide new technology for security and student devices. And an additional $10 million in one-time funding increased capital maintenance to a total of $33 million, which will be used for 61 facility repair projects. The county is contributing $3 million in one-time funding to the Art Studio 345 to support a new site that is expected to open in fiscal year 2028. When it is open, the site will double the capacity from 200 students to 400 students. $1 million in one-time funding for library collections will bring the total to $5.4 million in county funding for collections this year, and additional funding was provided to the library for 2 positions, as well as programming and operating costs. A community service grant to Heart Math Tutoring will serve third-grade children in 26 CMS schools, with the goal of 95% of students demonstrating growth in at least 2 areas. So since 2022, the county has provided $284 million of new funding to educational attainment, and this includes $120 million in the annual ongoing budget increases over that period and $33 million in one-time funds.
Here we can see the grade level proficiency data for CMS across the last several years. Of note, the data for 2019-2020 school year is unavailable due to the pandemic and the effect that it had on schools and student testing. The data here shows the percentage of students who achieved at a 3 or higher on their standardized end-of-grade or end-of-course testing. The left side of the slide shows the EOG testing for students in grades 3 to 8. The data breaks down into two separate groupings, with white and Asian students towards the top of the chart, with approximately 4 out of 5 students achieving a 3 or higher. Black and Hispanic students are towards the bottom of the chart, with approximately 2 out of 5 students achieving a 3 or higher. Given the closeness of these two groupings, I've only displayed the annual result labels for the white and the black students, but the other data is available should you want to see that. On the right side of the screen, we see the same data point, grade level proficiency, for groupings for the end of course testing for students grades 9 through 12. Overall, the story is largely the same for both charts, with all demographic groups trending upwards in the years following the pandemic. However, the observed disparities between the white and Asian students and the black and Hispanic students does remain unchanged. On this slide, we see the same categorizations, but this covers college and career readiness. And college and career readiness shows the percentage of students who achieved at a 4 or higher on their standardized end-of-grade or end-of-course testing. Once again, data is displayed in the same way, with the EOG testing for students in grades 3 to 8 on the left and EOC testing for students in grades 9 to 12 on the right. The white and Asian students towards the top of the chart have approximately 3 out of 5 students achieving a 4 or higher, while black and Hispanic students have approximately 1 out of 5 students achieving a 4 or higher. As on the previous slide, the numbers on the chart represent white and black students. Again, the story here continues to be largely the same as with the previous slide, with most all demographic groups trending upwards or remaining consistent in the years following the pandemic. And again, the observed disparities between the white and Asian and the black and Hispanic groupings remains unchanged. Finally, on this slide, we can see the 4-year cohort graduation rates for the same demographic groupings that we've discussed previously. This data begins in 2015 and shows the graduation rates through 2024. While there is expected year-to-year variation, the overall trend is relatively flat from 2015 to 2024 across all groups. I do want to note that there was a large increase for Hispanic students from 23 to 24. And while any single data point should be treated with caution, this is a potentially promising indicator for this population of students that has been lagging behind the other students in graduation rates. Overall, educational attainment results have shown marginal improvement in some areas over recent years, but much of that growth that can be seen is serving to move students back towards pre-pandemic results. Certainly, we continue to grapple with the impacts of the pandemic on educational attainment, and we may continue to see that impact in the years to come. And while the county may be limited in our ability to directly impact these results, there are opportunities for us to have targeted strategies, such as via our MEC pre-K investments, for example, to continue to bend these curves in the positive direction over time. Given the board's focus on reducing racial disparities in the community, it's important to continue to keep a pulse on these community-wide indicators, as education is the foundation upon which other community-level disparities, such as employment or household income or home ownership, can be addressed. Later in the presentation, I'll speak more to these community-level indicators.
All right, now we'll take a look at the timeline for environmental stewardship. So going into fiscal year 2022, the board approved a budget priority that was simply parks and greenways. That year, the county advanced $30 million in capital funding to complete additional greenway miles. Also, the operating budget for Park and Recreation was increased by $16 million, including 58 new positions and operating, and the budget added $2 million for open space acquisition. For 2021, the operating budget for Park and Recreation included $4.6 million for positions and operating costs for Eastway Regional Rec Center and $700,000 for operating increases in other areas. In March of 2021, the board adopted a revised environmental leadership policy. Eastway Regional Rec Center opened in April with limited programming due to COVID-19, and park facilities also operated at limited capacity throughout that year, while many residents took advantage of outdoor amenities. And Memorial Stadium renovations were completed, and the stadium was reopened in July. At the retreat in fiscal year 2022, the board modified the priority to environmental leadership, expanding beyond parks and greenways to implementing the strategies of the Environmental Leadership Action Plan. The budget included $30 million for strategies in the plan, including $20 million for land acquisition, $5 million for equity investments and 8 more of our county parks, $3.7 million for facilities, facility retrofits and solar installation, $2.3 million for electric vehicles, $3.4 million for stormwater restoration and mitigation, and $743,000 for invasive species control. Also, $13.8 million of our Round 1 ARPA funding was allocated for parks and environmental initiatives. That year, the county acquired 296 acres of land. We treated 1,390 acres for invasive species, purchased 22 electric vehicles, and installed 20 electric charging stations. We also began planning and design for deep energy retrofits and the Renewable Energy Master Plan. The fiscal year 23 budget included $67 million for Environmental Leadership Action Plan. This included $50 million for land, $9.7 million for facility retrofits and solar, $3.4 million for stormwater restoration, $2.3 million for electric vehicles and charging stations, $820,000 for 8 park and recreation positions and operating, $743,000 for invasive species control, $625,000 for idle reduction systems on medic fleet, and a real estate coordinator. The county also awarded $8.3 million in Round 2 ARPA funding for parks and environmental initiatives for a total investment of $76 million that year. In 2023, we acquired 499 acres of land, completed the plans for energy retrofits and solar, and treated over 1,000 acres for invasive species. At the retreat in fiscal year 2024, the board modified environmental leadership to environmental stewardship, expanding beyond the strategies of the action plan. We funded $60 million in investments that year, including $50 million for land, $5 million for solid waste capital needs, $3.6 million for stormwater team, and $557 for 5 positions to support outdoor park facilities, and 3 positions and $531 also to support parks, $454,000 for air quality operating, and in 2024, the county acquired 552 acres of land, established a new stormwater field operations team, and hired all of the new positions related to parks and environmental stewardship projects. This year, we have $62.6 million in new funding to preserve and protect the county's environmental resources. We have $50 million for land acquisition and tree preservation, $4.6 million for building retrofits and solar, $2.8 million for electric vehicles, and $1.1 million for charging stations, $2 million for farmland preservation, $877,000 for park and greenway maintenance, $485,000 to expand cooperative extension, $150,000 for solar subsidies, and $120,000 to conduct a pond study. So far this year, the county has purchased 188 acres of land, and 5 electric vehicles have been received, with 54 more that are on order. So from fiscal year 2020, when the priority was parks and greenways, through fiscal year 2025, the county has invested $437 million in new funding for environmental stewardship.
Land acquisition was a goal that was identified and developed during the drafting and development of the Environmental Leadership Action Plan. Since 2022, Mecklenburg County has acquired 1,535 acres of land for park and recreation use as part of the county's ELAP. This total includes closed transactions since 22 and through the end of the second quarter of 2025. As part of this work, the county has identified a goal to maintain a minimum of 19 parkland acres per 1,000 residents. As we can see, the land acquired since 2022 has allowed the county to maintain this target rate despite continued population increases within the county. And just for you as a point of reference, a 0.1 acre per 1,000 resident increase requires about 500 acres of land to be acquired. This will be an important consideration for the board and the county as the amount of available land continues to decrease while the cost of that land increases. Mecklenburg County established 5,500 acres of invasive species by 2035. Between 2021 and 2025, the county has treated or removed over 6,000 acres of invasive species, which has already exceeded that 2035 goal. Invasive species management can be a time-consuming effort, with each acre requiring treatment an average of 3 times. These various treatments include the use of appropriate pesticides, hand pulling, and also burning the invasive species that is present. And those invasive species can include plants such as kudzu, English ivy, autumn olive, or others. County staff continue to identify locations and opportunities to treat or remove invasive species across the county. Mecklenburg County is continuing the electrification of its fleet with a target of just over 1,100 vehicles by 2035. As of 2025, the county is at approximately 17% of this goal, or 186 vehicles. While the electrification of the fleet continues to be an important effort, it's important to remember that currently there's about 15% or so of the fleet that does not have an electric alternative. So currently there's about a maximum of 85% of the fleet that could be converted to electric. County staff continue to seek new opportunities to leverage electric vehicles for larger scale equipment, such as larger trucks or SUVs that are used to transport clients. As EV and battery technology continues to develop, there may be more opportunities to leverage EVs for these larger scale equipment uses. As the county continues to purchase EVs, we're also being intentional about the identification of charging station locations and subsequent installation. This process involves identifying where the future EVs will be located and then working to install chargers at those sites in the year prior to the delivery of the electric vehicle. This gives us enough time to ensure that the infrastructure is installed and ready to support the newly acquired vehicles. The county has a target of 1 charger for every 2 electric vehicles and is also working on opportunities to install fast chargers in the future, though currently there are no fast chargers in the county fleet. As part of the goal of being effective stewards of our natural environment, the county tracks the impact of our carbon footprint and associated strategies for reduction. The county measures emissions through direct and indirect sources. Direct sources are those things that we can actually turn on and off, right? So the fleet, natural gas, electricity consumption, those sorts of things, whereas indirect sources are those that the county has less direct control over, such as air travel or solid waste emissions. Mecklenburg County greenhouse gas emissions have decreased by 11% since 2018, and this is despite an approximately 11% increase in the total square footage of county facilities in 2023. This data on this slide represents the 2 most recent measurements of Mecklenburg County's greenhouse gas inventory from the EPA. This measurement is completed every 5 years. The reductions are due to several varied strategies, all with the goal of reducing county-related emissions. Mecklenburg County has improved energy consumption in county facilities, which is a result of the continued implementation of the Deep Energy Retrofit Master Plan. Several county facilities have already been completed as part of this plan and have demonstrated effective decreases in greenhouse gases. For example, the Judge Clifton Johnson building has had a reduction of 237 tons of greenhouse gases, and Betty Ray Thomas has had a reduction of 46 tons. The county's investments in EVs as well as solar are also having an impact on greenhouse gas emissions, with recent solar installation project at Medic having been completed with an expected reduction of 316 tons of CO2. These are all examples of direct sources and direct impact that the county has made. The National Ambient Air Quality Standard Compliance Indicator is a measure of the county's compliance with federal ozone standards. Overall, Mecklenburg County has a limited ability to impact this result individually, but this is a helpful indicator to understand where we are at as a community. To meet the federal health-based standard for ozone, the air quality result must be at or below 70 parts per billion. And our result for 2024 was 69 parts per billion, which is about 1.4% better than the standard. This result is based on a rolling 3-year average of air quality measurements. And because of this rolling average, the 2023 value includes the pandemic period when traffic volumes in the county were lower. The increase in recent years was expected as that pandemic period rolled out of the air quality data, and this has resulted in a higher result in 2024. As the county continues to move forward past the pandemic years, it's crucial to continue to work to reduce ground level ozone concentrations in the region, since continued improvements in air quality provide additional health benefits for county residents.
All right. So the next priority that we'll look at is housing insecurity. Back in January of 2019, as we prepared for the fiscal year 2020 budget, the board approved affordable housing as one of its budget priorities. For fiscal year 2020, we funded $22.5 million to help address affordable housing with a special focus on income levels below 30% of AMI. This included $11.2 million to establish a new affordable housing fund to provide rental subsidies and other affordable housing programs over multiple years. $1.3 million was dedicated for keeping families together to support housing for vulnerable families. The county made the first critical home repair allocation of $1 million. We increased the funding for legal aid by $500,000 to serve 500 more households with eviction assistance, and the Charlotte Center for Legal Advocacy by $170,000. The county also took over the Continuum of Care program previously managed by the city and added 2 new positions to CSS to support that program. And Criminal Justice Services more than doubled their housing assistance programs with 50 additional slots. In fiscal year 2021, we added $3 million for rental subsidies and another $1 million for critical home repair. 2021 also marked the first year of the Homes Grant Program with a budget of $250,000, which provided 551 grants that year to owners with incomes below 80% of AMI. The county also supported the residents of Hill Rock Estates with an $82,000 for the first years of funding for Roof Above. In April, the county provided a $1.5 million loan from the Affordable Housing Fund to Eastway Park, preserving 92 affordable units for seniors. In 2021, the ARPA funding for emergency rental assistance started, providing $63 million in rental and other assistance to Mecklenburg County residents. And later that year, the county transitioned more than 200 homeless residents from the North End encampment into local hotels. The board reaffirmed affordable housing as a priority for fiscal year 2022. The budget included $12.6 million of additional investments, included $7 million to the Affordable Housing Fund for subsidies and other programs, $3 million, $500,000 of which was ongoing, helped the Salvation Army to purchase a hotel serving 100 families a night, $1 million to continue critical home repair, and $750,000 helped the relatives open the new on-ramp center for youth ages 16 through 24. The Homes program provided 726 grants that year, and Round 1 ARPA funding included $8.7 million to programs providing long-term housing security to the Smithfield Community Coalition, Social Serve, and the relatives, bringing the total investment to $21.3 million. In fiscal year 2023, $4 million of funding was used to preserve 292 affordable units at the Pepper Tree Apartments. We initiated the Billingsley Road development in partnership with Dream Key Partners with $3.1 million and 14 acres from the county. The site is expected to provide 288 affordable residential units at completion. We funded $2.5 million for critical home repair. A Home for All strategy to end and prevent homelessness began in partnership with United Way. The county provided $778,000 in startup funding. The budget set aside $500,000 to study the impacts of corporate-owned housing. $300,000 provided housing assistance to 51 more clients through CJS, and we provided $100,000 for planning grant for Pottstown. And round 2 of our ARPA funding from the county included nearly $40 million to programs providing long-term housing security to various housing initiatives. Going into fiscal year 2024, the board revised this priority to housing insecurity to include homelessness along with affordable housing. The fiscal year 2024 budget allocated $31.2 million of new funding for this priority. A major expansion in the Homes program of $14 million from the city and the county was included to mitigate some of the impacts that we expected from the revaluation. At the end of the year, 4,306 residents had received $2.2 million in grants, and the remaining dollars have been carried forward to continue providing those grants this year. In 2024, the board allocated $6.5 million to purchase and develop property on Graham Street. The budget included $3.1 million to implement a Home for All strategies, and administration for the program was increased by $222,000. The county also provided $2.9 million for additional rental subsidies, and $2.6 million to continue critical home repair, and $1.7 million for year 2 of the Billingsley project. We also increased funding for legal aid by $200,000 for a total of $1 million, which allowed the organization to serve approximately 1,000 clients a year. In terms of NOAA investments made from our Affordable Housing Fund, $4 million was approved to protect 266 affordable units at Charlotte Woods, $3.5 million preserved 100 units at Brook Hill, and $3 million was approved to preserve 36 units at 30% of AMI at Ascent Pineville. This year, the annual budget includes $17.3 million in new funding to support housing insecurity. $12.6 million is set aside through the Affordable Housing Fund for a Home for All strategies. $2.6 is included for critical home repair. Another $1 million will cover half of a year of the operating cost for Forest Point. Annual payments for NOAA agreements will be $537,000. $280,000 is being used to continue reentry housing agreements that were initiated by ARPA. Funding for legal aid was increased by another $200,000 to serve more clients. And in November, the board approved $2.5 million to provide 80 affordable units through the YWCA Grounds for Change project in partnership with Dream Key Partners. From fiscal year 2020 through fiscal year 2025, we have made $300 million in new investments for housing insecurity. This includes an increase in ongoing funding by $21 million, $80.5 million in one-time funding, and $128 million of ARPA funds.
So the county has defined housing insecurity as the lack of stable occupancy of decent, safe, and affordable housing. These supports manifest as a spectrum of services, from affordable housing subsidies and support services to critical home repair and eviction prevention. We'll discuss each of these, but first we'll begin with an overview of homelessness in Mecklenburg County. The overall number of individuals experiencing homelessness continues an upward trend, as does the individuals experiencing chronic homelessness. As of October, there were an estimated 3,244 people experiencing homelessness in Mecklenburg County, with 789 experiencing chronic homelessness. I do want to note that the recently released State of Housing Instability and Homelessness report shared slightly different figures, but they were also looking at June, whereas this is looking at October. And that uptick from June to October is consistent with annual or seasonal and cyclical increases from month to month. The number of people, The number of people experiencing homelessness continues to increase, with racial disparities persisting, and we continue to see an overrepresentation of people of color experiencing homelessness, with 73% of the overall homeless population identifying as Black, African American, or African. The Community Support Services Department continued its expansion of efforts to address housing instability and homelessness. This included collaborating to develop a community-wide street outreach plan that ensures a coordinated response to the growing number of persons living unsheltered. In addition, CSS enhanced coordinated entry by implementing the Housing Problem-Solving Intervention, successfully piloting a coordinated entry-based homeless prevention and diversion approach, and improving access by hiring several bilingual staff. The final phase of Forest Point Place, permanent supportive housing for people 55 years or older, was completed in December, and as of this month, the property was at 50% occupancy. Once fully occupied, it will serve 90 individuals. Per the State of Housing report, the number of households who are cost burdened, which is contributing more than 30% of their income to housing, continues to increase. 50% of renter-occupied households and 22% of owner-occupied households report being cost burdened. Community-wide, we've traditionally seen that lack of affordable housing impacting those households in the low to low moderate income ranges. However, over the past 2 years, we've seen a growing number of households in that moderate income level reporting housing cost burden, with 61% of renter households that earn between $50,000 and $75,000 paying more than 30% of their income on housing. To help meet this need, the county has funded many programs meant to assist with finding housing and providing housing assistance for those in the community. These programs include Keeping Families Together, which focuses on permanent supportive housing for families, A Way Home, Housing for Good, and MEC Home, which focus on the rapid rehousing of various groups such as families, young adults, and single individuals, and Link Housing, which focuses on transitional housing for those long-term stayers at shelters. Since 2020, over 1,900 people have been served, and nearly 1,300 people have been housed via these programs. The total number of individuals served and housed, as well as the housing stability rate, are all increasing year over year. While there continues to be a need in the community, the targeted investments that the county has made in recent years have had a positive impact on the lives of many families and individuals across the community. In addition to the programs mentioned previously, the county's Criminal Justice Services Department also provides housing services to its clients. CJS works with justice-involved populations, and several years ago identified that housing was a growing need for its reentry population. These individuals face numerous barriers to housing, including criminal history or unaffordability or various housing and shelter restrictions. Supporting these clients as they seek to transition into the community post-incarceration is an evidence-based way to reduce the likelihood of recidivism and therefore support the county's commitment to public safety. CJS's Vendor Network Housing Program formally launched in 2020, and since that year has served more than 1,800 clients in various capacities and placed 426 into housing. This population faces unique barriers to housing, but the results have continued to increase year over year. Since the program exited the pandemic period in 2022, it's continued to see annual increases in total exits, as well as the percentage of successful exits. Critical home repair is an important part of the work done under our housing insecurity priority. This program provides comprehensive repairs designed to address issues where a homeowner's health and safety might be at risk. Extending the functional life of the home allows the owners, often seniors living on fixed incomes, to age in place in the safety and security of their own home, while also preserving more of our community's affordable housing units. Since 2020, there have been over 350 critical home repairs completed, and 119 of those came in 2024, which was a 95% increase over the previous year. On the right side of the screen, I've broken out the 2024 results to show you the locations of these repairs and the associated partner that provided the repair. The teal bars represent critical home repairs completed by either Habitat of Charlotte or Habitat of Greater Matthews and are grouped by the location or jurisdiction of the repair. The purple bars at the bottom are repairs by the specified vendor, either for the struggle or rebuilding together, and may have been located throughout the county. Eviction prevention services are critical to helping keep our residents in their homes. These services provide legal advice, representation, and eviction prevention or diversion assistance to low-income people to avoid evictions. County partners with Legal Aid of North Carolina and the Charlotte Center for Legal Advocacy on these programs. And since 2020, Mecklenburg County has provided legal advice to over 2,800 individuals, legal representation to over 3,200 individuals, and prevented or deferred nearly 1,800 evictions. Overall, the housing situation in Mecklenburg County continues to provide challenges to our residents. Clearly, there's been positive impact from county-funded or county-run programs, but that impact is, of course, limited. As the board sets its next priorities, it will be important to keep in mind what aspects of housing insecurity and affordable housing the county may be able to impact.
All right. As we look at the priority for health access, as you know, the county has been working to improve access and promote healthy behaviors as part of one of our core responsibilities for a very long time. I'm going to begin the timeline for you here in 2020, which is around the time that the health department received reaccreditation from the state and met all 147 standards and received top scores on all 5 categories of the reaccreditation. The fiscal year 2020 budget for public health was $85.8 million, a $6.1 million increase to enhance services for county residents. Then on March 12th, we had the first case of COVID-19, and the Public Health Department quickly shifted to meeting the demand of the pandemic. That year, the CARES Act of 2020 provided $39 million in emergency funding. The county spent $24 million on county expenses and $15.2 million on community investments. The fiscal year 2021 adopted budget included an additional $3 million to address food deserts, $2 million to develop strategies to reduce disparities in health care, $660,000 in other health-related expenses, and $320,000 to develop a gun violence prevention strategy. We began implementing SNAP double bucks and other programs to improve healthy food access. We hired maternal and child health, community health workers, and an epidemiologist. And the Health Department initiated partnerships with 10 community-based organizations. Midway through the fiscal year, the first COVID-19 vaccines began to roll out. By the beginning of the next fiscal year, 30% of the population had received at least one dose of the vaccine. Our fiscal year 2022 budget included $4.5 million in investments to improve health access. We began a partnership with the Steve Smith Family Foundation for the creation of a behavioral health urgent care, provided $977,000 for salary adjustments for school nurses. PrEP funding increased by $610,000 to serve 469 uninsured patients. $592,000 in funding allowed us to maintain transportation services despite changes that occurred with Medicaid transformation. We expanded food security programs by $389,000. Growing cost in public health required an increase driven by TB cases, the need for therapeutic services for disabled children, and interpreting services. And round one, ARPA allocations provided $29.6 million to behavioral health and health equity projects for a total of $34.1 million in new investments that year. So in fiscal year 2023, the operating budget included $10.5 million in new funding. We increased funding to MEDIC to provide salary increases. In 2023, the state eliminated caps for adult daycare and in-home aid, but did not provide any additional funding. The county increased the adult daycare rates from $40 a day to $84 a day, which at the time cost $2 million, and changed the local cost share from 5.5% to 54%. The county increased in-home aid rates from $22 a day to $28 a day, costing $969,000, and the local cost share went from 35% to 50%. The county established MeckHope as a permanent program, investing $1.6 million to the collaborative. The county began a $1.6 million partnership with Alliance Health for crisis respite cottages for youth. That year, we initiated a partnership with StarMed to expand primary health services with 2 clinics. We expanded food security initiatives by another $389,000 and began the Our Smile Dental Collaborative with Lake Norman Community Health Clinic. Our ARPA Round 2 allocations provided $36.7 million to behavioral health and health equity for a total of $47.2 million in new funding that year. The board first identified health access as a budget priority at the annual budget retreat for fiscal year 2024. Later that year, the state of North Carolina became the 40th state to expand Medicaid, and by July, 54,000 residents were enrolled in Mecklenburg County due to the expansion. We added 75 federally funded positions to support Medicaid expansion, 111 economic services positions. The county funded a new autoloader stretcher system for MEDIC and provided funding increases for salaries. The county committed $3 million to the Three Sisters Market Capital Campaign, currently in pre-construction. We provided $2 million to the Charlotte Rescue Mission. The county expanded the eligibility call center and increased pay for school nurses. We provided $1 million to the Cabarrus-Rowan Community Health Clinic, which is now serving 750 patients annually. Another $350,000 to the CRCH brought mobile health services to the Center of Hope, which now serves 500 people a year. We expanded the mobile market program with 2 new vans and expanded senior meal delivery mills, or senior home delivered meals and congregate meals, which now serve an average of 4,325 meals per week. $350,000 was set aside to develop a behavioral health strategic plan. Many smaller investments were also included in the budget, which I don't have listed here. Also, in 2024, 2 new mobile health units were put into service with grants from the CDC. Later in 24, the Charlotte Rescue Mission Rebound Center opened with a total of $10 million in support received from the city and the county. The site provides 166 beds for homeless men seeking addiction treatment. The fiscal year 2025 budget includes $11 million in new funding to support the board's budget priority for health access. Medic has begun vehicle replacements and technology updates. The Health Department will use $1 million in Medicaid escrow funding to contracted staff, immunizations, testing, and supplies at their clinics. A new youth and family emergency shelter is planned to open later this year. The shelter will provide 6 additional emergency placements. $704,000 has allowed the county expanded the in-home aid services by 50 clients for a total of 220. As of December, 213 residents were being served by in-home aid. We have onboarded the new staff to support the mobile dental unit, which served 183 patients in the first quarter. Also, 10 uninsured patients will receive pediatric dental treatment through our partnership with the Save a Smile program. The budget includes funding for 5 new health access-related CSGs and funding to continue health trips for seniors expanded with ARPA funds. The Charlotte Is Home Center opened in August with the support from the county and has served 335 clients. So the county has made $263 million in investments in health access between fiscal year 2020 and fiscal year 2025, which is detailed here.
So we'll begin our health access overview by looking at residents served by our primary care partners here in Mecklenburg, specifically regarding the uninsured populations that are served. Mecklenburg County Public Health measures the number of uninsured residents served across all primary care contract partners to understand the changes in their capacity over time. The partners that Public Health works with are one part of the solution for uninsured residents and families who need primary care, with other stakeholders like healthcare system partners playing an important role as well. Overall, we can see that the uninsurance rate has stabilized within the county. It's dropping just a little bit as well, despite the continued increase in population each year. Following the pandemic, the number of Medicaid recipients served and the number of uninsured residents served has also stabilized. I do want to note that since the state launched Medicaid expansion in December of 2023, the 23 result here does not include the impact of that expansion, and therefore we would expect that results, when available for 24, would increase. I'd also like to note that the county's 3rd federally qualified health center, or FQHC partner, Cabarrus-Rowan Community Health Center, is not included in this data because Mecklenburg County's location did not open until February of 24, and 24 results are not yet available. That said, since 2019, over 93,000 uninsured residents have been served by Mecklenburg County primary care partners. Next, we'll briefly discuss some of Public Health's clinical services. Public Health measures the number of patients that its immunization services and sexual health and family planning clinics treat to understand the level of service provided by those clinics and how that changes over time. 2024 results for the number of patients served decreased from the prior year, primarily due to lower demand for Mpox vaccinations, and demand for childhood vaccinations like MMR, varicella, polio, and Hep B remained roughly consistent with previous years. For the Sexual Health and Family Planning Clinic, 2024 results increased due to additional access points for these clinical services, specifically at the Ella B. Scarborough CRC, increased community engagement, and additional capacity at the Northwest and Southeast Public Health Clinic locations. Overall, since 2019, over 71,000 patients have been served at immunization clinics, and over 59,000 patients have been served at the Sexual Health and Family Planning Clinics. Mecklenburg County Public Health also measures the number of patients served through the state-funded breast and cervical cancer control program to track changes in how many women receive access to these services each year. 2024 results increased from the prior year due to additional mammography events, which increased the opportunities that patients had to receive those services. The program also improved the consistency of processes used to follow up with and reschedule patients who missed their initial appointment. Since 2021, the Breast and Cervical Cancer Control Program has served over 2,000 patients. The rate of new HIV cases in Mecklenburg County has been declining over the past few years, while the corresponding rate for the entire state has been flat during the same period. I do want to note that 2020 data has been excluded and is treated with caution due to the limited availability of testing and delayed reporting that we experienced due to the pandemic. Key drivers of the stable trend may include increased testing, higher rates of PrEP utilization, and a greater proportion of HIV patients accessing treatment. Additionally, the HIV viral suppression rate in the Ryan White program has been broadly consistent for the past several years. For context, the Ryan White program provides medical and support services for eligible people living with HIV. Public Health also measures the participation in its food as prescription and double bucks programs to better understand the reach of these programs and improve participants' access to fresh and healthy food. Food as a prescription program increased the number of participants from 23 to 24 by launching a new cohort of 500 Novant Health patients participating in the program. Food insecure clients in this program are enrolled through Atrium or Novant to receive a monthly stipend to purchase WIC-approved produce. That stipend can range from $40 to $80, and participants can use it to purchase fresh food at Food Lion, Walmart, dollar stores, and other locations. Since 2022, the Food as Prescription program has served over 7,300 people in Mecklenburg County. The Supplemental Nutrition Assistance Program, or SNAP Double Bucks program, helps community members make the most of their SNAP benefits at participating farmers markets by providing a dollar-for-dollar match to purchase fresh, local produce. Utilization of the Double Bucks program increased in 2024 due to increased marketing and awareness campaigns, as well as other incentives. Public Health partnered with the County Public Information Department and the Public Health's Food Security Team to conduct social media campaigns and out-of-home awareness campaigns focusing on SNAP Double Bucks at farmers markets. Those campaigns have been rolled out on billboards, geofencing ads, and with CATS Light Rail, with CATS alone estimating to have 1 million impressions that are obtained based on estimated ridership numbers. Additionally, Charlotte-Mecklenburg Food Policy Council has conducted awareness promotions at farmers markets, implemented a triple bucks program funded by Public Health, and provided produce incentives at markets. Equally important in the health access priority area is access to behavioral health. The county's Child, Family, and Adult Services Department manages 26 behavioral contracts with the following partners to increase access to behavioral health and related services. Overall, these 26 partners have helped the county to serve nearly 74,000 individuals since 2021. And when specifically looking at the number of individuals served via the CFAS behavioral health contracts in 24, the county has seen a 121% increase when compared with 2021, while funding has remained consistent. Additionally, in the behavioral health space, the county's behavioral health strategic plan was finalized and published in June 2024. This plan is a product of a steering committee made up by key partners, advocacy groups, and funders in the behavioral health systems, who all worked together from November 22 to April of 24. The county held nearly 30 public engagement events, received input from nearly 700 residents, and the county conducted stakeholder interviews with local advocates, service providers, and individuals with lived experience to inform the development of the plan. Now that the plan has been finalized, the implementation team has convened, and this multi-entity team will collaborate with the selected implementation vendor on meeting targeted objectives and providing broad oversight for accomplishment of the plan objectives and strategies.
Workforce development was first identified as a budget priority going into fiscal year 2022. That year, we increased funding to CPCC by $1.5 million. The county began a partnership with Road to Hire that provided technology education for 363 high school seniors, of which 217 received scholarships to attend college. An increase of $100,000 to the MEC Success program provided housing stipends for 11 residents. A new partnership with the Center for Employment Opportunities provided job opportunities for formerly incarcerated residents. A grant to Aspire Community Capital was used for workshops and coaching for entrepreneurs, and $75,000 to Prospera was used to serve 121 individuals, with 8 receiving business loans. That spring, 26,000 students, 18,000 of which were county residents, were enrolled in CPCC, and $8.1 million of Round 1 ARPA funding was approved for various nonprofit workforce development partners. In fiscal year 2023, the county provided $2.6 million of additional funding for Central Piedmont. That year, 28,000 students were enrolled in the spring. Community Resources used $1.1 million to create 3 new workforce development programs with The Rock, She Built This City, and the Urban League. The county received $1 million through a request by Congressman Alma Adams to expand unified workforce development. HR began the MEC Pathways program to provide paid internships to 73 high school students, and 3 new IT positions were created and filled by graduates of the Road to Hire program. MEDIC and CPCC partnered to create an EMT training pathways program, resulting in 28 new EMTs. $120,000 supported the Business Launchpad program, graduating 48 participants, and $10.8 million in Round 2 ARPA funding was directed to partner organizations for workforce development programs. In fiscal year 2024, Central Piedmont received $2.1 million of additional funding. That year, 31,000 students were enrolled in the spring. The MEC Success program was completely redesigned and expanded with an additional $1.3 million of added support for 50 families in total. The Office of Economic Development expanded the Business Launchpad program and the Get Up and Grow program, which served 46 businesses. We created a new position for the Small Business Concierge and Lending programs, and an increase of $60,000 to the Community Culinary School of Charlotte brought annual county funding to $140,000, allowing the organization to train 60 to 75 students each year. The board approved a new CIP with $107 million for Central Piedmont, including a public safety training facility, line worker training facility, and advanced technology center renovations. The budget this year includes $5.4 million in new funding for the Arts and Culture Plan to provide opportunities for artists to build skills. The county is also renovating the Visual and Performance Arts Center. The county increased funding to Central Piedmont by $2.1 million, and 13 renovations and repair projects will be completed with $6.8 million of capital maintenance funding, which includes $3.1 million of additional one-time funding support. We also annualized the expanded MEC Success pilot program, which is currently working with 30 families, with 30 more that are planned for the second cohort. Funding to continue transportation expanded with the ARPA funds has provided 205 educational trips and 4,691 employment trips as of December. Funding for the Pivot program is supporting manufacturing internships for 21 high school students in the Lake Norman area. And there is $19 million of new projects included in the 5th year of the rolling CIP for Central Piedmont. Since workforce development became a board priority in 2022, the county has made $64 million in new investments over that 4-year period.
All right. So as we reviewed the data for the workforce development priority area, we'll first begin with a look at the county's unified workforce development program, then broaden our scope to the county's other internal and external workforce development programs. The county's unified workforce development program provides access to rapid employment placement, supportive services, and job retention support to Mecklenburg County job seekers experiencing 2 or more barriers to employment and stability. These barriers are listed on screen and include things such as justice system involvement, a history of mental health concerns or substance misuse, homelessness, or being a survivor of domestic violence, among others. Next, I'll share some specific results from the county's unified workforce development program on the following slides. Since 2020, the Unified Workforce Development Program has employed over 430 people. These are individuals who faced 2 or more of the barriers we discussed previously and who would otherwise have had a difficult time securing employment. The most recent year, 2024, shows a 116% increase when compared to 2020, demonstrating that the program continues to grow and provide impactful services to this population in need. When we look at the average hourly wage, we can see that it too continues to increase each year. When compared to 2020, the average hourly wage has increased by 39% to a 2024 average of $18.12 per hour. While the specific number of individuals served and the average hourly wage are important indicators, so too is the employment retention rate. The retention rate tells us how many of the program's participants who were placed in employment were able to maintain that employment for at least 6 and 12 months, respectively. Results for both the 6 and 12-month retention rate have remained at or above the 70% target for the past several years, and program staff cited vendor improvements to their ability to maintain contact with the participants following their program exit as a reason for this observed improvement. This slide briefly summarizes the performance of our Department of Community Resources Workforce Development Partners. The number of employed result reflects the unduplicated count of participants placed in employment through a DCR partner. As many of our programs serve customers with lower education or skill levels and/or significant barriers to employment, the most common positions were entry-level and included customer service, warehouse, cleaning, and food preparation and serving. As we can see in the table, the largest number of individuals placed into employment came from Charlotte Works, which is housed at VCW Community Resource Center, and the Latin American Coalition. Collectively, these two partners have helped over 2,200 people obtain employment between 2020 and 2024. The table also shows that while those two programs have placed the most individuals, the most recent hourly wages have been higher for some of the other programs, such as those providing vocational training. So, for example, both the Urban League, which largely serves the maintenance, banking, and healthcare fields, and She Built This City, which places into the community services and maintenance fields, both have 2024 average hourly wages over $20 per hour. Like the previous slide, I've summarized the same information for several of the county's internal programs here. The county's Empowering Fathers program offers employment assistance, coaching, and training opportunities for non-custodial fathers facing employment barriers. Additional services include fatherhood and parenting skills, economic stability, mental health services, and others. We can see here that this program placed participants primarily into the transportation, general labor, and security fields, and had an average hourly wage in 2024 approaching $18 per hour. The county's Economic Services Division includes Work First Employment Services and Food and Nutrition Employment Services programs. This internal division has served over 2,100 people since 2020 and has placed these individuals into healthcare, food service, transportation, and automotive industries with an average hourly wage of about $16 per hour. In addition to the Unified Workforce Development Program that we discussed earlier, this slide also includes the Reentry Services Program within our Criminal Justice Services Department. When we discussed reentry services earlier in the context of housing, that team also provides employment services and has had great success placing clients into construction, warehousing, and food services industries, again with an hourly wage of about $16 per hour. Finally, I've pulled together the internal initiatives, the contracts, and the partner data to provide a holistic look at the outputs and outcomes over the past 5 years. In total, these programs have served nearly 8,000 job seekers and placed over 6,000 into employment or an internship. This amounts to a 77% placement rate for these programs and demonstrates the impact that the county and its partners can make for our program participants. Of course, despite these positive impacts, there is more work to be done, as we've heard at this retreat. And I'm actually just going to roll through two racial disparities. So I'll close out my presentation today with a discussion of racial disparities, the work that the county is doing internally, and how this is beginning to manifest in community perceptions of the county, as well as community indicators that can help us track overall trends that we see in the community. The county's Office of Equity and Inclusion, led by Sean Carter, has been working with the county departments to develop the county's Equity Action Plan, parts of which we have discussed at this retreat. One aspect of the plan is to invest in county employees through educational training opportunities with the goal of improving interactions and outcomes within the community by having the county workforce that better understands how they and their roles impact equity and inclusion in the community. To that end, it's important to regularly measure how county employees are feeling regarding the equity and inclusion work within the county, as this is one of the first internal inputs into that theory of change that I briefly mentioned. As part of the county's annual employee climate survey, the Office of Strategy and Innovation includes equity and inclusion questions designed to help track perceptions of equity and inclusion within the county's workforce. On the left, we can see that nearly all of the county's employees feel that they positively impact outcomes for Black, Indigenous, and people of color through their work at the county. In the middle, we can see that about 90+% of county employees understand how their role is important in advancing racial equity in Mecklenburg County. And on the right, I show a newer question that we began asking in 2023, which shows that about 90% of county employees feel that they have the skills to act if they see or experience discrimination in the workplace. Collectively, these three data points tell us that our employees overwhelmingly see how they specifically can impact equity outcomes, and they feel that they know how to counteract discrimination if they encounter it. Next, we have some additional questions that have more mixed results. On the left, we can see that approximately 4 out of 5 employees feel that they are equipped to speak about race and feel supported by leadership to be responsive to the racial equity needs of their coworkers and community. While these results are just shy of our target of 88%, they are close to that target. However, we do have opportunities within our workforce. On the right, we see 2 questions that show that more work is needed to facilitate regular racial equity conversations between managers, employees, and coworkers. These results are shared each year with our Office of Equity and Inclusion, who are working on strategies and engagements designed to increase these results. Previously, I mentioned that the work that we do internally as well as externally directly with the community should result in improvements in community perceptions of the county, and we are seeing these improvements in recent years. This slide shows results from the county's annual community survey, which I shared with the board a few months ago. Given today's presentation, I thought that it would be helpful to bring this back again as an indicator that we are seeing positive changes in community perceptions of the county's equity and inclusion work. The line on the top represents the trend in the question, Mecklenburg County honors the identity of individuals and treats them with dignity and respect. As you can see, the results increased by 10 percentage points from 23 to 24, no doubt due in large part to the great work done by the county's equity and inclusion team. The purple line at the bottom shows the trend in the question, Mecklenburg County services and programs are racially equitable. Again, we see a similar increase from 23 to 24, this time with a 9 percentage point increase. While we recognize that there is still much work to be done, it's promising that we're beginning to bend the curve upward on these indicators. Next, as I know there's interest from the board, I've included some community indicators to help track the overall trends that we see in the community. Sean talked a little bit about this yesterday, but Raj Chetty said that education is the surest pathway to a better life. And when he did additional research connected to his economic mobility study, he found that educational attainment and level of employment were the surest ways to determine the likelihood of a child would move out of poverty. Additionally, we know that access to high-quality educational opportunities has always been at the forefront of the fight for civil rights, and that higher degrees of education reduce the most acute realities in our society, such as reducing incarceration rates, improving health outcomes, enhancing civic participation, and positively contributing to intergenerational wealth creation. The next few slides will discuss community indicators beginning with educational attainment, this time at the community level rather than just within the context of CMS, employment status, median household income, and finally home ownership rates. Before we dig into those results, though, I do want to preface this by noting that these are community-level indicators. As such, it's important to remember that any one entity, the county included, is going to struggle to unilaterally influence these data points. Sustained and collective community action and attention are required to impact these sorts of results. And as we develop the board's new priorities and have conversations about definitions of success, staff will focus primarily on measures that we can directly influence as the county. However, if there are associated or relevant community indicators, such as these, we will also work to include those indicators for context for the board so that you all can fully understand the breadth and depth of the issues at hand. So on this slide, we see the educational attainment breakdown for the community across 3 recent years. Each year is broken down by race and ethnicity, and the bars represent those who have earned a high school diploma or less, that's the teal bar, those with some college, the red bar, and those with a bachelor's degree or higher, which is the purple bar. When we look across the years, we can see that for both white and black residents, the proportion of individuals with a bachelor's degree or higher continues to increase. However, while those groups continue to increase, the gap between the two is not changing. It remains consistent. Next, we'll discuss employment status. These results have been relatively stable and have only seen small changes. The charts here show the same demographic groupings as the previous slide and show the percentage of each group that is not in the labor force, again, the purple bar at the bottom, employed, the teal bar, or unemployed, which is the red sliver at the top. Overall, there's not been much change in employment status since 2021. However, the percentage of black residents that were employed did increase by 3 percentage points from 21 to 23. Following that theory of change that we began discussing with education, if educational attainment gaps and disparities were improved, we might expect to see corresponding improvements eventually in the employment status indicator. Next, we briefly look at median household income within the county. Charts here continue our trend of disaggregating community indicators by race, and I've also showed the overall median household income, which is that red line in the middle. And I've highlighted the white-black income gap for each year displayed. So, for example, in 2023, white households had a median household income $51,000 greater than black households, or about 1.8, 1.9 times the median income of black households. We can see here that while the median household income is increasing year over year for all demographic groups, the observed disparities remain largely unchanged. And while the median household income for both white and black households did increase, that income gap between the two did not change. And so to link this back to our previous two items, we might expect that increases in educational attainment would eventually flow through and result in more people employed in the county and employed in higher paying jobs, which in time would result in increases in median household income of residents. And while we don't see that yet in the observed disparities between the groups, this can be a helpful community indicator to track as many of the county initiatives and programs that we have talked about can contribute to changes in this data. Finally, if we were to increase median household income levels within the county, we might expect to see an increase in home ownership rates. We've discussed in detail at this retreat the challenges that our community faces when it comes to affordable housing and housing insecurity. And those challenges are also present here in this data. On this slide, we can see the percentage of each demographic group that owned their home, the teal bar, and versus renting their residence, the purple bar. While we did see homeownership rates increase from 19 to 21, those rates have decreased somewhat across most demographic groups from 21 to 23. And unsurprisingly, we see a corresponding increase in the proportion of individuals renting their residence. As I mentioned before, given the sharp increases in home prices and the associated challenges that presents for residents when buying a home, it's not surprising to see trends swing back towards renting. So, in closing, as I wrap up my presentation, I just wanted to take a moment to summarize the performance across your current board priorities. The results across all priorities show that there have been positive impacts. There have also been some indicators that have not changed much, and there are still others that present opportunities for improvement. The main takeaway that I'd highlight for the board is that when we're targeted with our priorities and clear about our goals, we can make positive impact for the residents of Mecklenburg County. That may not always be possible in a year or two or three sometimes, but over time, it is possible to meet and achieve those goals. So I share this because later this afternoon after lunch, we're going to transition to a conversation about the board's 26 through 27 priorities, and it will be important for us to be specific and targeted in those efforts. And with that, that concludes my presentation on the performance results, and I'll hand it back to Adrian.
All right, just one more slide. This slide simply summarizes the investments that the board have made over those varying time periods that I went over. And they total to $1.6 billion in new funding. $288 million over 8 years beginning in 2018 for early childhood development, $437 million over 6 years for environmental stewardship, $263 million since 2020 to expand health access, $284 million to educational attainment since 2022, and $300 million over 6 years for housing and security, and $64 million over the 4 years since 2022 for workforce development. And that concludes our presentation. We'll take any questions that the board has.
Well, thank you both for that. It's a lot of information to absorb. Just because I know everybody's wondering, we are going to do more than 3 minutes. This is a lot to react to. And but with that being said, just so everybody's clear, it will creep into the time on the agenda that shows for lunch, but it's needed. We are not going to take a break. Please take breaks individually between now and lunch if you need to. But what I'd like to do is also ask us, to the extent that it's possible, if there are questions that are going to be posed, if they can be, if the information can be received later, please indicate that so that staff knows that they can follow up, or if you need that question answered now, you can indicate that as well. And the last thing that I would say is I definitely want to lift up what we saw today came under the leadership of Commissioner Dunlap as our chair for the time frame reference and Commissioner Powell as our vice chair. And I think some of the indicators are just amazing when you look at the level of investments. And so I definitely wanted to lift up their leadership, and you can also see the fingerprints of board members throughout all of the slides. So with that being said, I do want to kick things off with, Madam Clerk, we're going to do 5 minutes per. You're not going to be able to go over 5 minutes, so I am going to put a stop to it. We're going to start off with Commissioner Dunlap, we can go with Commissioner Powell, Townsend Ingram, and then Meyer, and you can just flow into it after the person's done.
All right, thank you, Mr. Chair. I guess one of my biggest concerns as I've listened to this is, as we try to tighten our belts, looking at the various funding buckets and figuring out where the excess money is being spent. And I don't want to necessarily look at our accomplishments, but just the extra dollars itself. And I'll give you a couple of examples. And I'll have some questions in here too, Dina. When we met with CMS, we learned that there were a lot of vacancies, maybe 200 and some odd vacancies, I think. Mech pre-K, what have you. My question is, do we give a pot of money, or do we pay as we're billed?
I think they get their money monthly, or David, when do we?
Let me give you, I guess, 2 answers to that. You budget a
I
certain
think I was
amount.
going to ask them, David, a
Okay,
question.
David?
How often do they get their money?
We pay them once a month, but it's not a bill, it's just 1/12 of the amount that we budget for them in total.
Well, they have
Not on
people
a
working on
reimbursement
it.
basis.
So we're actually paying for unfilled positions then?
That's correct.
Yes.
Okay, so that's an area that I'd like to see more focus on, because we shouldn't be just giving them money because we allocated X number of slots.
That's what we're doing.
We should pay them based on who they're serving. I think that is a significant savings when you're trying to cut or tighten your belt.
But now they're using the money to bring people up.
That was my biggest concern, because this is the kind of stuff that you really need to dig into in terms of trying to see if you're getting what you're paying for.
Right.
And I just don't have enough time to do that right now. So, Mr. Chairman, I'm going to yield my time, because I just need more time.
Thank you, Chair, Mr. Dunlap. Commissioner Powell. I think, were you not next up?
I didn't think so.
Oh.
Can
Yeah, I think,
you just put me
sure, I
in the
can.
queue?
Yes. Next up, Commissioner Townsend Ingram.
Thank you all very much. That was a lot of information. And two things that kind of stood out to me. One that it's kind of near and dear to me is behavioral health. So under the county behavioral health contracts, we have 26 behavioral health contracts that we provide, and I'm assuming that's for all families for wraparound services, not just CMS, right? Or,
Yes,
That's correct.
okay, how are we assessing whether or not these are working, whether they're reaching the target? Is there anything that's provided in a way of reporting back to us to say these projects are working, that these are contracts that we should continue?
That is
So I'm going
something.
to ask Anthony to respond to that, please.
We have a new team that is assessing all of the behavioral health contracts.
Speak louder, please.
I said, we have a new team that's assessing all of the behavioral health contracts and developing performance metrics for all of them. And we are changing our contract structure to pay for performance versus just providing an allocation for a majority of the contracts. There are some contracts like Anuvia where it's a consistent service where we just pay them for the service because it's very clear on the activities that they perform.
So is there capacity, I guess I'm asking, as we're looking to become more efficient, there's probably capacity to eliminate where there's overlap?
That is correct. And our team has developed a contract assessment plan to assess all the contracts, and they are prioritizing those contracts based off of the mandated services that we are required to contract for, and then the board priorities, and then the value add. And based on that, they already are communicating with many of our behavioral health vendors as to the changes to the contract structure for next fiscal year.
So those recommendations will be ready by the time so that we'll know which ones need to be prioritized?
Yes, absolutely.
Okay. My other question goes to the eviction prevention services. Sheriff McFadden just sent another, email about the number of evictions that were ongoing, and I wanted to know, obviously success would look like no evictions, but based on how it's trending right now, what's working with the eviction prevention services? What exactly are we offering, and what do we hope to achieve? What's the goal number? Because it doesn't seem like we're moving in the right direction.
So in terms of what we're offering for eviction prevention, that is done with our partnership with legal aid and legal advocacy.
And it just, when you hear the word legal aid, and I know because I hear it so often, there's so much red tape. People don't even want to try to reach them by phone or wherever if they got to get somewhere, go somewhere to get a consultation with them. So it just seems like we need to have a little bit more detail and focus. If there's a trend, if it's trending the wrong way, we got to do something different. So would love to see some more data.
So we have two areas that focus on eviction prevention. One is the legal aid contracts, and the other is crisis assistance ministry. And we have data and reports for both of those areas that we can provide to you.
Okay. Thank you. So.
Thank you. Commissioner Meyer.
Thank you. Yes, that was a lot to think about. I will try to get through this. Looking at 470, I'm really alarmed that the cognitive benchmark continues to decrease, and that doesn't make any sense to me. Is that, everything else seems to be leveling or increasing, and it doesn't make sense, and that's alarming to me. Is it a measurement instrument issue? How are they being measured?
Sure. So that's measured via the TS Gold assessment. So that is something that we ask the staff, and certainly I invite DCM Trotman to add anything that he has here. But that is something that they are currently looking into so that they can better understand that decline. But it is an observed decline in the assessment.
And it's this is just Met Pre-K. It's not NC or whatever?
Yeah, so that's correct. So currently, and let me get to 470 here. So currently, this data here is just for MEC Pre-K. We are working to try to better understand similar data for NC Pre-K and others, so that, and Bright Beginnings, so that we can potentially compare. But right now, this is just MEC Pre-K. Okay.
Am I the only one alarmed by this? Because it's a crazy number.
Maybe you can help me here if I don't get this right, but TS Gold it's an observed
That's correct.
behavior, right? And I think what they've been trying to do over the years is make sure that there's better fidelity in terms of how those observations are taken. And so I'm wondering, and I don't have the answer, but I'll find out whether or not them trying to have more fidelity is getting us better results, not actually a decline, but more accurate. But I will follow up and see if that's the case.
So it's basically, if it's observation, it's objective. So I can understand. Okay, thank you for that, Dina. And also, on 481, obviously there's still a gap between white and black and Hispanic, and clearly that is something that we're all very much interested in. But I also just want to say that the numbers are still increasing on each. So that is good. The gap is not good. But I just think in continuing to invest in our kids in education, including pre-K, is, you know, of utmost importance on our behalf. That's my opinion. And on 490, what is cooperative extension? $485,000 for cooperative extension.
Yeah, cooperative extension is a partnership with the state, university, and the county, and it provides 4-H and other types of programs like Master Gardener program, that sort of thing.
Okay, okay. And then on 494, what is recommended by Park and Rec? We've gone way above and beyond, which is great, on treating invasives. What is recommended?
I'll expound if it's okay. One, I would note is that this goal was set when we were starting the Environmental Leadership Action Plan. And so it was us trying to, when we presented the information, we were trying to help you understand there was an interest for us to do things more swiftly, and there was an advocacy for us to have goals that went like to 2030. And what we were presenting to you is what impact we could make depending on if you fund at one level versus another level, and so we stretched the goal to 2035. However, when we shared you that information, we were just telling you when you purchase and you invest this money, you will achieve this.
Okay.
Y'all have also put in more money, so we have moved quicker and achieved more. That does not mean that there isn't, when we set that goal, it was based on funding. It wasn't the goal based on need. The need of invasives outpace what we have here.
And I'm curious about what the need is as compared
I
to
don't know
what.
if we can, I can walk with my team to determine if we can get a number to quantify that.
Okay, I know it's hard.
What I do know is there's more invasives than we have treated. That's what I would articulate. And then the second thing, which Michael also note, when you treat invasive, it's not a one and done. It is a three-step process. So each time we go to one area, we have to go back 2 other times before you can check the box to say you have achieved that. And that was not intentionally, that was not factored in when we were pacing the recommendations of helping you understand the difference between 2030 and 2035. So if we were to go back and recalibrate, that target would be very different today.
Okay. Can we move the goals?
We would have to increase it. Like,
Right, oh, yeah, definitely.
yeah.
Okay.
I would say, of course, you can move goals. If you feel like you achieve goals, you can exceed them. But I would say that give us the opportunity to give more informed data to inform what it should be if it needs to be
Okay.
revised.
All right, thank you.
Thank you.
Yeah.
Next up will be Commissioner Griffin, Leak, and Rodriguez McDowell.
You said 10 minutes?
So 15 minutes. 15 minutes for you, sir. There you go.
Okay. Let me start with MEC Pre-K. There are 9 of us on this board. None of us can say if those kids are ready for kindergarten. And I think what CMS should do.
Just a little bit louder, Mr.
So there are 9 of us on this board, and none of us can say that MEC Pre-K kids are ready for kindergarten. And I think that's a priority for me and should be a priority for us since we continue to invest in MEC Pre-K program. CMS, when they made their presentation, Dr. Baltnight standing next to Tim Givens both said, well, we got further work to do and hopefully we'll get it done by next school year in terms of kindergarten readiness. And for all of your information, most kindergarten observations are with individual teachers. And if you haven't seen kindergartners with headphones on a laptop trying to do an assessment, you need to go see that. It's not as effective as you think it is. But that is a sore point for me, is that we continue to invest in MEC Pre-K, and we do not have any idea whether or not those kids are ready for kindergarten. And as you so eloquently stated, Michael, that education is directly related to your observation about job attainment. We are really missing the boat. In terms of the CMS, in my personal opinion, is violating the constitutional rights of kids. And I'll tell you why. The Leandro lawsuit, everybody articulates, says they need $700 million. They forget also the part of Leandro lawsuit where the Supreme Court said what a sound basic education meant. A sound basic education meant level 4, which is college ready and career ready. And CMS continues to say the number of kids that are grade level proficient and above. They've already lowered the bar by one whole unit. So that's a problem for me. I hope it's a problem for others. Why is that a problem? As your representative at Central Piedmont, as a trustee, there are a number of Work First programs at Central Piedmont. But most of those Work First programs have an assessment at the beginning. You can't even enter Tesla unless you pass a test. You can't mess with electricity from Duke Energy unless you know something about math. So we can sit here and talk about how well we're doing, but the results, Michael, shows up. Can they get those jobs that are opening at Duke Energy and at Tesla? The answer is no. And you indicated most of those factors dealing with homelessness and all this, black folk on the bottom. We have a whole equity unit with Mr., forgot his name already.
Sean
A
Carter.
whole equity unit, and we never talk about the gaps and what we're doing specifically to close the gaps. But in terms of education, look it up, folks, what a definition of a sound basic education, and tell me if grade level proficiency is that. They don't match, okay? The other piece, in terms of housing insecurity, back in the old days, the county was nowhere close to housing insecurity. I mean, what you've done in terms of housing insecurity is phenomenal. From my perspective. I mean, you weren't doing anything when I was on the school board. Now, from my perspective, you're knocking the socks out, but you're not going to be able to address, because if you, in terms of your workforce development, is clapping your hands because people are getting $18 an hour, that's $37,000 a year, and our economist just gave us a report that a single person, no children, is $47,097.
66 an hour.
Okay? And so even at $20, when Michael said she built this city or whatever it is, that's $41,600. So we're moving people into poverty through our workforce development program. And I think we need to do better or recognize what we're doing in terms of workforce development. Health access, double SNAP benefits. I continue to ask how many people are participating and who's participating, but we don't have the data collection process to determine that. There are thousands of folk on food stamps. Wanted to know how many people are actually benefiting. You got 2,080. Mr. Trotman, I forgot. That's 5 minutes already.
Finish the thought, please.
Yeah, we just need to do a better job in terms of looking at outcomes. Right now, we are doing a lot of processing, and the outcomes, I'm not sure if those are the anticipated outcomes that this board is expecting. So, thank you.
So can I respond?
Please.
Just quickly, please? I just want to bring the board back to January 7th, when I sent a very full response to the board around kindergarten readiness and around MEC pre-K, and we did provide data on whether or not our kids are kindergarten ready. And so I'm going to go through the data again, because this notion that we don't know is not true. So,
Well, we don't know.
let me finish, please.
Okay.
Thank you. So in 2023, 2024, all CMS kindergartners entered kindergarten, 44% entered kindergarten ready. MEC pre-K graduates also entered kindergarten, 44% were kindergarten ready. 24, 25, all CMS kindergartners, 43% were kindergarten ready, and our children were 50% kindergarten ready. So we continue to improve outcomes for the children that attend MEC pre-K, and that is using the Dibbles assessment, which is the same assessment that CMS uses. So to say again that we do not know is not accurate. The other thing I'd like to say about workforce development is that you need to understand is that the people that we serve have multiple barriers to employment. So if we think that we're going to take our people and that they're going to walk into jobs making $60,000 a year, that is not realistic, and we need to manage expectations. And the partners that we have are training these folks to get into jobs that they're able to move into. So I think, again, unless we're going to change all of our partners and we're going to get rid of all of them and we're going to get new partners and we're going to have a lower success rate in terms of who gets employed and what the retention rate is, we can certainly do that, but the outcomes are not going to be as positive as what we see today.
Commissioner Griffin, go ahead and respond.
Yeah, man, with all due respect, Dibbles does not reflect kindergarten readiness. Dibbles reflects, do you know your alphabets? Do you know the sounds of your alphabets? Dibbles has zero to do with can you recognize your numbers from 1 to 10 or write your numbers from 1 to 10. Dibbles has absolutely nothing to do with your attention to detail. Dibbles is a formative assessment that specifically that CMS uses addresses your alphabets, your sounds. It is not a conclusive assessment to suggest that this child is ready for kindergarten because there are 5 separate domains. Dibbles only addresses portion of one domain, which is the one of literacy. There are 16 subtests within the 5 domains. So to suggest that Dibbles is reflecting a perspective that a child is kindergarten ready, I would challenge that observation with any academician who understands education and formal assessment. And if I'm wrong at our next meeting, I'll apologize. But I can tell you Dibbles, and I'll give you a copy of Dibbles when we get back to the office so that you can see what Dibbles actually measures.
So I understand what you're saying, but what I would say is that that's the assessment that CMS uses. And until we have another assessment, that is the assessment that we will be using to determine whether or not our MEC pre-K children are kindergarten ready. And I think Mr. Trotman may have another response to that.
Well, the original plan was to do a 10-year study on our MEC pre-K kids. And so we entered into a contract with a vendor to track our kids for that period of time. Then fast forward, the board or the HHS committee asked for a manual pool of our MEC pre-K kids on how they were doing in kindergarten. And so we worked with CMS for them to do a manual pool on all of our kids and provided that report to the HHS committee. So we continue to work with CMS to assess our MEC pre-K kids and how they're performing and however the board would like. It was difficult because CMS had to bring on, like, I believe, temp staff to actually do that manual pool and look at all of the data within their system. And it shows, similar to what the manager said, that our kids are performing at a better rate.
So
It's 2 against.
Give me 1 second, Commissioner Griffin. Give me 1 second. Here's how we're going to do this, because we could go back and forth all day, and I want to be respectful of other commissioners as well. What I'd like you to do, Commissioner Griffin, I will come back to you. What is the specific, I guess, policy prescription that you are trying to drive us toward consideration? I think understanding, we understand that you know the specifics around it. I guess what I'd like, or board members would like to understand exactly where you'd like the board to go. But I don't want you to answer that now because I want to hear from some other ones. We can come back to that because I know you'll have an answer on that. I want to go to Commissioner Leek and then Commissioner Rodriguez-McDowell. But Commissioner Griffin definitely will come back to you. Commissioner Leek?
Are you ready for me?
Yes, ma'am.
Let me first say thank you for making this presentation easy to follow. And I said to the vice chair, thank you, honey. I said to the vice chair, how can we take each section that we've covered and dispense it within the community so that the people will know what we're doing with the money and who's actually getting the money and who we support from this board to be the recipients of the money? What are we changing? And that bothers me because there are those who serve on some boards that we never report from, but receive money from us. And I'm not mad about it. I'm just saying, let's be fair in the process. So I've asked that each section, when we start with education, and I've always talked about the quality of our education is not what it ought to be for those that look like me. Everything that we accomplish depends upon our education, if we can read right. 3 of us fell out at this board meeting that we had when they first came on here, the new 5, about education. And to this day, it has not changed. So what can we do? And I've talked to the chairman about this, not the former chairman, but the present chairman who's willing to listen and see that there are disparities there. I'm always bringing up the problem of quality teachers. And I'm not saying that we don't have quality teachers. I'm not saying we don't have a quality leader. And I'm not saying that parents are not doing their job. But there happens to be problems. I was on the school board for 11 years. I taught for 38 years and was never fired, not accused of not doing my job. My evaluations were always good. But that was when teachers were teachers. So don't misunderstand me. That's when principals were principals. And I understand clearly what the gentleman is speaking about because we experienced it together who work with the system. And to say to me in this public that we cannot talk with board members of the education about the problems, we need to converse. We put on a show, but we don't do anything or get anything accomplished, me included in the process. So that's where I come from with education as the focus of all that we do. And in District 2, it's where your lower level schools are. And you talk about unperforming schools in my district. You talk about disparities of jobs, education. All of this fits within the confines of District 2. So what can we do to stop throwing the money in a basket and not getting real results? Not getting real results. And that's where I'm coming from. How can we make sure that the same people are not draining the budget and the results are not there? And I'm not just talking about teachers. I'm talking about across the board that we provide services to and services for. Health is a problem. Housing is a problem. The community is a problem. Violence, all of these issues are dependent upon the support of the others. My question is how many parents and families are receiving all of these benefits from the county? Some people are on 2 and 3 programs receiving money from the county. But is it changing anything? How do we stop one family from being recipients through education, through health, through whatever else we have, happens to be the winners in receiving, but not changing the behavior of these individuals? And I'm not blaming you, so please don't think that. I'm talking about the public and the people we are serving and how we serve them. I thought we were going to take each one at a time and deal with it rather than to complete the whole package. Am I to stop now?
Yes, ma'am.
Well, thank you. Thank you so much, Mr. Chairman. I hope you understood where I was coming from and the depth of my concern about the district, because if they live, they're going to get old.
Thank you, Commissioner Lee. Mr. Attorney, will you, I think we've heard a couple of times this theme around education. Can you remind us exactly what our scope and ability is with respect to our relationship with CMS?
Can't even talk to them.
Well, when you say your scope and your relationship,
Well, when we previously had legal action and arbitration and things of that nature, I guess I'm just trying to level set where we were previously, what we were trying to do, and what was the result of that, so that we can understand exactly what our scope, how it was adjudicated with respect to our scope of ability to influence CMS. I mean, we have the power of the purse to a degree, but if you could just remind us of where we were, what we were trying to do, and what the result of that action was, will, I believe, help put it
Right.
in some general context so that we understand what we can and cannot do.
well, I think the pivotal issue is we don't control CMS, we fund them. And our issue at the time was the amount of the funding. We had the mediation, which the statute allows for, because CMS disagreed with the amount of funding that the manager recommended. But to get into the depths of the education, we cannot control the way CMS educates. You can certainly put out your performance metrics and things the county would request for the dollars that we provide to them, but we can't control it.
Thank you. Commissioner Rodriguez-McDowell.
Thank you, Mr. Chairman. I first want to say that I appreciated how you guys connected, the budget information with the outcomes by each one of these, categories. And I think that was really, really helpful to tie them together. And, but I do think that I agree with Commissioner Leek that going section by section for me would have been more effective to have discussion time after each one of these sections. And so I think that, some folks might say, well, that would take up too much time. But that's the point of having a budget retreat, right? Like, we're supposed to be digging in and drilling down. In my view, this is what my impression of what the budget retreat is supposed to be. And I think it's been said over and over again that it's to give feedback to the manager and to staff about the board's priorities and where we would like to see investment. And so, for me, this is ineffective amount of time right here, because I have questions that were for each section, and now I can't even remember the first section anymore, and so I'm just saying that I think that, like, yesterday we had a transit-oriented development hour that had nothing to do with our budget. It was a complete, in my view, waste of the time that is precious to us to spend together discussing our responsibilities and where we want to see our funding. So with that, I know that many of our investments take a long period of time to see results. And so I think another thing that jumps out to me, I like how you showed ongoing versus one-time investments. And I think it would be helpful for me to see that continued as far as where the ongoing expenses that are being increased year over year are going, and separating out fund balance. And especially, there are certain areas that take way more fund balance than general fund. For example, the environment. It looked like a big, large number, but a large percentage of that came from fund balance. So that's different. My bottom lines are, I agree with Townsend Ingram about legal aid, evictions. I think for our affordable housing priority, I think that is such a place where we belong, and as opposed to building new units, unless it happens to be on county property that we are converting from some other purpose. Funding teachers. In my view, education comes down to teachers. Funding teachers That's where we're going to get results, whether it's pre-K or whether it's at CMS. I also had a question about childcare. Are we only funding, like this, page 461, childcare? Are we doing anything about childcare centers to stand them up, or is that more of a state responsibility that we don't want to take on another thing that the state is supposed to be funding? And this is a question that I have. Or is it mostly just subsidizing particular kids?
We just provide subsidy. We do not provide infrastructure investments into the child care facilities.
Okay, so those are still struggling, and they're going to continue to struggle. And I'm always interested in how we can tie the child care portion to, the economic impact of those parents being able to work, both individually to the families, but also to our economy. Like, are there numbers or metrics that we can tie those together to show how those investments pay for themselves or not? It would be great, and I don't know if that's possible to measure, but it's something that always comes up in my mind, how much of that is actually paying for itself and is really important to continue and maybe even increase. There's.
Keep going. Keep going.
Well, I don't want to open up a whole other can of worms, so I'll just stop there. Because believe me, I got a lot of can of worms down here. So I'm good for now.
I want you to have the opportunity.
Open them up.
No, it's okay.
You made the point that it's the budget retreat, and so go ahead.
Yeah, no. I'm not ready because my notes are like
All right,
freaking all
coming
over the
back to
place
you.
here, and so I'm
Get
trying
your
to.
notes together, and we're coming back to you.
All right, thank you.
Commissioner Altman.
Thank you, Mr. Chairman. Can you please go to slide 547? All right, while you're headed there, it shows I believe, the different household incomes of our residents broken down along demographic lines. And I am reminded of an early conversation I had with the late Cozy Watkins. She sat me down and she looked me in the eye and she said, "Our residents are facing the death penalty, some of them, and you need to go out and fight for them." And I never forgot what she said. So I think everybody here is, certainly upset by some of the more disturbing indicators that show we just still have so much to do. I really appreciate the fire in the belly of Commissioner Griffin. For example, I love MEC Pre-K. I hope it is a smashing success. It makes sense to me.
That's right.
But you know what? At $288 million, if it's not doing the job, we have to, evaluate that at an appropriate moment, and we probably aren't there yet. But, we don't have money to waste. And so if it turns out that something that seems like a great idea isn't, whatever it may be, and I'm certainly not suggesting that about MEC Pre-K, but whatever it may be, we need to repurpose the funds because our challenges are so great, we can't afford to waste a dollar, which is why I'm so happy that this board has given our manager the authority to come back and really look at all of our programs to see how we can save and be sure that we're funding programs that are working. So just philosophically, I think that's really important, that we stay open. I mean, I think that we've served, if I counted correctly, 10,000 students through our first priority. And if my numbers are right, that comes up to be like $28,000 per capita. I don't know if I'm right about that at all. I'm not known for my math skills. But if I'm right, then it's all the more urgent that we be sure the programs are really working. So that's number one. Number two, I had asked to have a presentation on what workforce development investments and programs have been made that didn't exist prior to 2020. In other words, what are the programs and investments that were created as a result of the workforce development becoming a board priority in 2020? And there are things like CPCC funding that's included in the final amount for workforce development. And so I was trying with my question to be clear, I wanted only new funds to be put in, not things that were ongoing. Now, I believe all the priorities have that going on, like educational attainment has, things that were previously funded in that priority. So I recognize that. But I would like to know that number today, if possible, just because I did ask it in advance and I really do need it. If it's not possible, then it's not. But and I would like to lift up a question that Chairman Jarrell had asked. How well are we moving people off the rolls of social services? Again, only because we have such scarce dollars, we want to be sure that we're being effective in helping people get on their feet. I don't know that we really know, like, how long of the X number of people who are receiving these services. It would be good to have data around the duration of each of, the duration of the people receiving support. I don't think I've ever seen that. And, are 80% of them been on for a short period of time, a long period of time? What does that tell us about what we're doing? I feel like, when you say our investments have had positive impacts, I agree, 100%.
Okay.
But as we well know, positive impacts is not sufficient. We need to set benchmarks. We need to know what kind of progress we're making so we can figure out how to triage the limited dollars that we have for things that have the most positive impact. So I hope, this push of this board to move more towards SMART goals is very urgent. Okay, that's it for now. Thank you, Mr. Chairman.
Thank you. Commissioner Powell.
Thank you. First, I want to thank you, Chairman Jarrell, for, when I did my prayer at the meeting last week, and I talked about unity and really hearing each other, I can tell that you are leading that way, like making sure that you listen to everyone. And I really appreciate that because every single person here has a passion for something and it matters. And you can see that in the priorities. Like, I'm thinking like that we should just all like this is a happy moment to see some of the work that's been done in the last 6 years.
I agree.
Yeah, like wow, like I feel like doing a cartwheel. So some of this work is really good. And so I really appreciate some of the comments that Commissioner Altman just made, because I was writing down notes like it would help if we knew what the investment was per person on workforce development. Like I was dividing how much money we spend on Pivot per person that's in there, and it comes out to be significant. And so on some of the slides, we're talking about how do we increase opportunities for partnerships. So how do we get the manufacturers to meet us? Like it's not just Mecklenburg County funding it. How can we work with the manufacturers? Because it benefits them. So it would be helpful to have that kind of information. And then when Commissioner Altman said the duration of people receiving support, I think that's really important, because what is the incentive? We're trying to create situations where there's upward mobility. Are we doing that? And, what are the incentives to move forward without the county supplementing all, so what is the duration? I think that's important. I think what Commissioner Griffin said was really important about how do we explore additional assessments to make sure that children from pre-K are kindergarten ready. Can we do more assessments than what CMS requires? Like, it's good to do what they do, but can we do something else, that would help us know more? And then for invasive species, the need is much greater. I wanted to tell you, Commissioner Meyer, the need is much greater than the funding, but because we have to be balanced in our approach, we just set targets, because you can't give all the money you need to anything. And so it's really impressive what Natural Resources staff has done. I expect we will probably win a NACO award. And I do want to say this today because our Mecklenburg County forester, who's one of the best in the nation, is retiring today. And so Krista Rogers, today is her last day, and I'm very sad about it, but she was one of the leaders on the invasive species program. And so on this day, I hope we recognize with gratitude the work she's done. And I also want to recognize, talk about partnerships. This partnership with the Providence Square, I'm just really impressed with what economic development did. And I'm especially impressed with the willingness of Daniel Levine. He sent me an email, personal email, about how he wants to learn about invasive species. And I'm going to frame it because it's just one of the best emails I ever got. And the willingness of a developer to learn about why it's important and to make a commitment to planting natives and not any invasive species is a big deal. And so I think we're making a really positive difference. And, as I look at these priorities, it's just, I'm so proud. I'm just so proud to work with such good people who have done such good work. And, we can always do better. So, and I'm sure I'll have more questions, but for now, these are all the thoughts in my mind. Thank you.
Thank you.
Thank you.
So I know we wanted to circle back to Commissioner Griffin. I want to give Commissioner Griffin 2 minutes or less, Commissioner Dunlap, and I did speak to Commissioner Rodriguez-McDowell, and I think she's in a good space right now, and then I'll have a couple things to say prior to going to lunch. So Commissioner Griffin.
Yes. Chairman Jarrell, before,
Yes.
I just want to address the question about how long individuals are staying on the social
thank
services
you.
programs. Because I think 3 of you have now asked this
Yes.
question. One, there are 3 main social services programs: Medicaid, SNAP, and TANF, or Work First. And second, we cannot prescribe our own local rules for these programs. So we have to follow state and federal guidelines. We do not work with Medicaid beneficiaries to help them with upward mobility. What we do is determine Medicaid eligibility, and once they receive the benefit, they have access to medical services. But we do not work with them to find employment or any of those things. And it's actually against policy for us to work with them unless they desire to. So in the SNAP program, there's SNAP employment and training. The state has taken over the training portion of the employment and training, and they've outsourced that to local vendors. We work with some individuals to help them find employment, but there are several other vendors that help them find employment as well. It is our responsibility to determine them eligible for the benefit, to give them access to the SNAP card for them to gain access to food. And then the Work First or the TANF benefit, there's only a small portion of individuals that are receiving that, and that was included in the report that was just presented. And so we have data on those 3 big programs. All of the other local programs, we have data on all those programs as well.
Yeah, I think I'm probably not asking the question the right way is what the problem is, because I definitely appreciate the response, but I think, well, I don't want to creep into everybody else's time. So thank you for the response. I'm going to find a different way to ask the question,
Okay.
because I definitely hear you. Let me go with Commissioner Griffin, then go with Commissioner Dunlap, please.
Right, just 2 things with respect to kindergarten readiness. I use North Carolina General Statutes 115C-43.5 that requires developmental screening and kindergarten entry assessment addressing the 5 domains of school readiness. Not 1 domain, 5 domains of school readiness, and to do that within 60 days. I also use and rely on the North Carolina State Board of Education policy dated 5/3/24 that requires assessment of kindergartners within the first 30 days using the 5 domains of learning. And one of those is math. And so notwithstanding comments you've heard earlier, that's the basis that I use. Plus, I talked to a kindergarten teacher yesterday who said they do more screening other than dibbles. Policy question for me is we're investing in MEC pre-K. We can't tell CMS what to do, but since CMS is required by law and regulation to quantitatively and qualitatively record this information from the early childhood assessment. I'm simply asking us to ask CMS to help us with our MEC pre-K program. And I understand that we can't do anything for or demand anything from CMS. So from a policy perspective, how can we improve our program and they can continue doing whatever they do and we can look the other way? So thank you, Mr. Chairman, for that.
Thank you for the clarification. I think that helps me and probably the rest of the board. Madam Manager, that's a takeaway that we can continue to explore. Obviously, we can continue to explore that. Is that a reasonable expectation
I
from
would
your
have to ask the
perspective?
superintendent her views on that, but what I would probably say, based on what you said and your conversation with the kindergarten teacher, they probably are doing those assessments with all the children, but they may not be tracking it on a district-wide basis. So I think we need to get more clarity on whether they're doing the assessments and whether or not they're tracking that data on a district-wide basis. I don't know the answer to that. All I'm telling you is I can ask the superintendent and see what she says, and beyond that, there's very little we can do.
Well, to the extent that we can go ahead, I feel like it's a reasonable expectation. It's a clear question, so manager says she's going to ask and then follow up with the board on whatever that response is, and then we'll figure out how to react from there.
Thanks, sir.
Thank you. Commissioner Dunlap.
Thank you, Mr. Chair. God grant me the serenity to accept the things that I cannot change, the courage to change the things that I can, and the wisdom to know the difference. And so, as I thought about this board has adopted a lot of priorities that we really don't control. We are a funding source for the people who control it. That's hard for some people to accept, but we are a funding source. And so what I hope we will do, number one, and we have done this continuously, is to stop funding programs where we have no data to support its effectiveness. We will implement a program for 6 months and then we add more money to it without knowing what the outcomes are for the initial investment. So one of the ways we can tighten our belt is to do just that. I understand everybody's passionate about education. That's why I was on the school board for 13 years. But the fact is, we can't control what they do. We can invest in what they do, and we trust that when they tell us, if you give us X amount of dollars, we'll do this. Well, they haven't delivered. But we have a choice to either stop investing or to continue to invest, hoping they'll get the outcome that we want. But we can't change the outcome. And so one of the things that helps me with my stress level is knowing if I can't change it, it is what it is. But I will certainly invest in CMS with the hope or the expectation that we'll get the results that we're looking for.
Thank you.
Thank you. Commissioner Leek?
I'm happy that we're having this discussion as what would be a part of what we're trying to come to an answer response. And I'm so happy that we're taking the time to take this apart and to say about what we believe to be the right thing. Yes, education is important, but then we go around the back and get somebody else to start a program and they ask for money for education, and we're funding that. So when do we stop biting the back door to get to the front door and sit on boards that we support rather than those that's going to impact this community? And I thank this body today because I never felt good about this board until just a few moments ago when we started hearing the report and the sections which I thought we were going to take and digest and do something with it rather than let one or two people handle it. There are 9 of us on the board and not 5. And we make the decisions that's going to impact the community because they elect us. That's all I've been saying since I've been on this board. There are 9 of us and not 1. not 2, not 5, but there are 9 of us who make decisions. We may not like it, but I appreciate you, Mr. Chairman, for being consistent and fair and not taking your other energy to try to crush somebody because you don't agree with them. We don't have to agree. You marry folks you don't agree with. You deal with people you don't agree with. But there comes a time when we have to put that apart. And when I discovered that, when I found out that there were those who were trying to get me off this board, and I have to say it. Keep trying, but save yourself first.
Commissioner Meyer.
Thank you. I will be very quick. I just want to agree with Commissioner Dunlap where we are a funding board. This is what we do. This is our purpose. And sitting in the CMS joint meeting, a couple weeks ago, I think most of us congratulated CMS because the numbers are going in the right direction. And it's not going to change drastically in 1 or 2 or 3 fiscal years. And so I think what we're doing is correct, what we've been doing in the last couple of years, funding education at the level we need to fund them. And I agree with Commissioner Rodriguez-McDowell. It's all about the teachers. It's who's in front of the classroom that makes a difference. Thank you.
No, thank you. Thank everybody for their comments. I want to thank you guys for the presentation. Do you mind going to that last slide, please, that shows the new funding to board priorities? So I think it's really important to put everything in context. One, I hope the community realizes how passionate every board member is, and how when you look at, $1.6 billion is nothing to sneeze at. It is nothing to sneeze at. That's a significant investment to the community, to our most vulnerable, to the population we serve, with a lens on trying to improve the quality of life for the residents of Mecklenburg County, not just this generation, but future generations. And I hope the community understands that you're seeing the robust discussion, because no one on this board, no one in this room today, whether they're elected or not, is taking a victory lap, even with these investments. We're not a victory lap. We're not saying that we've won. We're not saying that there's no more work. We still realize, in the discussion that you see, is we say there is a lot of work to do. With that being said, absent a lens of saying that, hey, we are seeing progress in certain areas, maybe not to the extent that we'd like to see and at the rates we'd like to see, but we are seeing progress in certain areas. I am concerned about disparities and the rate of disparities that continue to grow, particularly based on race. When you look at income, wealth inequality, those gaps, particularly based on race, are certainly areas that we need to continue to focus on. The educational piece are areas we need to continue to focus on. And I am confident that this board will continue to do that and will continue to challenge one another. I mean, housing is another area, certainly. A talent pipeline is another area. I'm confident that this board will continue to do those things. And this type of dialogue is critically and vitally important. We owe it to our constituents to make sure that we are having substantive dialogue. And then we should walk away in a respectful manner. So I thank you all for what you've done. Commissioner Rodriguez-McDowell, next time we will certainly take your comments into consideration and break these things up. I own that. I own it, and so, but I definitely will take that into consideration next time and break it up, to your point. So let's go.
Break it up.
And you said break it up too, Commissioner Lee. See, I'm getting old, I'm just forgetting. But anyway, what we're gonna do is let's go to lunch and reconvene at 12:30. Thank you, everybody.
Thank you so much.
I'd like to know.
know that was a quick lunch, but got a couple big rocks to move this afternoon. We're going to go into the priority setting and then go with the aspirational goal setting. Madam Manager, do you want to add anything or have us think about anything before we move forward?
No, I do want to just say one thing, and I understand all the feedback that we've gotten on the presentation, but I do want to just say, for my part, I'm incredibly proud of county staff and the work that they've been doing. And when you look at all that's been accomplished since 2018 with $1.6 billion, I think is something that we should be celebrating. And if any of our team is listening, I just want them to know how proud I am of them. So thank you.
Thank you, Madam Manager, for that context. And I think the board would agree 1,000,000,000%, without question. So thank you to county staff for sure. There is one thing I want to say, Michael, before, and I like the new look.
Thank you.
Like, that is really,
I'm going a little bit
really
more casual
cool
this afternoon.
It's the nighttime. No. So when we go into the priorities, and I had this discussion with Michael, and I think, Madam Manager, I think you may have said this too, and I don't want to put words in your mouth, but I think you may have alluded to what I'm about to say as well. When we look at our priorities, if we're already on track with the current priorities or where we've been in the past, it's we don't necessarily have to continue to go down that road. I'm not framing it exactly right, but Madam Vice Chair, do you want to kind of frame that up for me in a better way?
Well, I think, I had asked Dina, for example, we are really, working hard with MEC Pre-K. It's going to continue for the time being, for sure, to be funded. I mean, obviously, we'll continue to reassess all of our programs for their metrics as the years go by, but I feel confident saying that MEC Pre-K is going to continue to be a part of our portfolio for the foreseeable future. So is that something that needs to be identified as a board priority, since it's, like, for example, ACM Trotman is supervising 4,000 people doing an amazing job every day with SNAP and TANF and, all the programs that your very large staff is working on. We don't make that a board priority because you have that locked and loaded. You're doing a great job. And so the question that I put to the manager was, does it make sense for us to think about our board priorities to be something that we want to put new focus around, or something that we think needs extra energy or new energy? Does that make sense to you? And you can share your answer.
Well, I think it makes sense to a certain degree. What I would say is, we fund your priorities at a higher level than in some cases we would fund sort of ongoing operations. So if you put something in as sort of an ongoing operation, we would not necessarily put new funding into it. So I just would want you to be mindful of that as you start to think about what you want us to spend money on. I think that's really the important part of that.
One second.
We will put money where you tell us is important. And if you tell us these 5 things are important, that's where we're going to spend the money. If you decide whatever one of these priorities needs to be baselined in the budget, it will stay pretty much steady state unless for some reason we weren't able to do it, but we would not probably increase funding for it.
Right.
So I would just keep that in mind as you decide what you want us to invest in.
That's helpful. Commissioner Lee, you had a comment?
My question is, a young lady spoke to us yesterday about a new program, and she's not here today. What was her name? She said she would tell us more about it.
Are you talking about the seniors? Was it Kim Henderson?
No, not the seniors. I can remember that.
I'm not.
It may have been Abby with Livable Mech.
Oh, Livable Mech, Abby Wyatt.
Livable, yes.
Livable Mech. Mm-hmm.
How will that fit in with what we're trying to do? Because we're already doing it.
Well, I think, again, what she's doing is really looking internally to the county for sure, but also looking externally to see what our collective impact that we're having across the county in all these various domains. So it's internal to the county, but it's also, a lot of it's mostly external. And I don't know, Anthony, if you want to add any more to that.
My last question, for the community's sake, to know about it, I mean, what is its purpose if we already have it, the community is doing it?
So that we can report out on the accomplishments that we're making as a community, and we can identify gaps and where we need to lean in further to accomplish different goals.
But publicity is what you're talking about?
No, I think it's more about making sure that all the organizations are meeting, they're talking, that we're all tracking the data the same way and reporting out on our program so we can measure collectively what we're doing as a community.
So how does that eliminate our communication department?
It does not. It has nothing to do with the communication department.
I just want to make sure.
No, I understand that, Commissioner. What I was trying to make sure that we stayed focused on, though, was for this priority setting, more so than going back to anything that we've discussed previously.
Anything new was coming, for clarity. I didn't ask anybody else, that's why I asked it now.
No. I think, just to put it in the right context, it wasn't anything new. What I was asking Abby Wyatt to do was to come back to give us additional, I wanted us to take a deeper dive into Livable Mech so that we could go in and address some of the questions you have and some of the questions that certainly I was disconnected from that I mentioned yesterday. And so, but that's not necessarily going to be part of the priority setting.
Maybe I misunderstood it then.
I don't think so. I think we're on the same page.
We can talk offline about it, Commissioner Leak, if you'd like.
Say what now?
We can talk about it when we get back. We can set up a
That'll be fine.
meeting.
I just want to make sure we were here.
Yeah, let's talk about that when we get back. We can schedule a meeting and
That'd
talk
be
more
good.
about it, okay?
Thank you.
Thank you. Commissioner Dunlap.
I think Commissioner Altman pretty much said what I was going to say. But I wondered if, well, let me just put it like this. Every 2 years, we have an opportunity to assess our priorities and to what degree we met our objectives and whether or not we want to change. This is an opportunity to change if you want to do something different. So I was going to ask Dina is, if we had a different priority, still with a focus on one of these priorities that we might want to change, would that reduce funding? Or would it just mean that the funding would stay the same?
I'm not sure.
The question is, to what degree do you fund something? For example, and this is just hypothetical, since it's the first thing on the list, early childhood education. We have a priority there, so we spend X amount of dollars on there. But if it was just a focus of ours, could we spend less, not totally wipe it out or not fund it at all, but spend less and have more of a focus on something else?
Well, you could, if you funded less, then you'd be eliminating seats. That would be the only way for that example, for pre-K, that'd be the only way you could do that is you'd have to eliminate seats.
Well, we need to eliminate seats because they're not using them all.
Well,
I'm
they're using all of our seats.
What was that? Now I didn't hear it. What was it?
He's given a hypothetical, Commissioner Leak, around what the funding would look like if we changed our priorities. Would the funding stay baseline? Would it be decreased or not? And so I think that, if that's what you were driving towards, George, I think that's what you were saying. I thought I heard Dina say earlier that the priorities get funded at a higher level and essentially it would be baseline unless we come in and say, hey, cut it.
Right, and it depends how much money we have and to the extent that we could baseline things.
Got it.
Based on the
And we
available
think it's gonna
dollars that
hurt
we
one of
have.
the programs.
Got it. All right, let's move on with Michael. I think we all understand what can happen. The options are going to be change priorities, keep priorities. Again, I think one of the things that we've learned on the board is just because something is not identified as a priority does not mean that we're not going to still continue to, there won't not be a focus on something, okay? This is just where for lack of a better word, the extra emphasis will be placed. Michael, take it away.
All right. So to start with, I just wanted to remind us about kind of what we did yesterday and what we're going to do today, right? So we ended yesterday with our strengths, opportunities, and challenges activity. And today, that is going to kind of roll into the first thing that we're going to do, which is our priority identification and selection, right? So behind you on the wall, we have some initial categorizations, right? And I really want to stress that those are initial. So myself and my team, as we've thought about what we've heard from you all, what you've talked about over the last 2 days, we've identified some initial buckets, right? And I'll just read them off for you, but you'll have an opportunity to look at them in a bit. We've got economic development, racial equity, fiscal management, environmental management, a spot for other things that maybe we didn't identify, housing, health equity and wellness, and workforce development / upward mobility. So again, those are just initial categories to kind of be a catch-all or a catcher for the gold worksheets that you have that we'll talk about in a second. But we will also gut check each of those, right? So once we put your potential priorities or the issues that you've identified on the wall, myself and Julia will go through each of these, make sure that, hey, does what you've identified as the potential priority, as the potential issue, align with this initial categorization? If so, great. We'll leave that one there, and we'll come back and do a round of voting for your priorities a little bit later. Or if we realize that, hey, there are multiple different kind of sub-themes under this that we need to break out, we'll kind of have that discussion. So I just wanted to reiterate that these are starting points, not our ending point. So once we kind of go through that, and that's going to be the exercise that we'll go through during this second session, where you'll all have another opportunity to work on your gold sheets. We'll put those on the wall. We'll have discussions. We'll ultimately vote on what your priorities will be for 26 through 27. And then we'll lead into our third and final session this afternoon, which is priority refinement. We're going to change that up a little bit from what we've got in your packet, but we'll talk about that a little bit when we get there. We wanted to give you all more space and place for conversation at the table so that you can kind of talk with your peers about what's important to you. And so we're going to pivot away from some of the small group work back to just a larger, longer time period for group discussion. So you've got a copy of this in front of you, but like we mentioned yesterday, we ended with those gold priority sheets. We're going to start there again today. So I understand, there may have been additional thoughts or conversation that maybe you had after the session yesterday, or maybe after the presentation that Adrian and I did this morning. You may have had some additional things come to mind. So we wanted to give you another 10 minutes or so to revisit and revise your potential community priorities. And then once everybody's ready, we'll take those and stick them under the category that they most align to. And like I said, we have other topics here, just understanding that there could be, probably are things that we didn't necessarily have a category for, so you can stick those on the door as well. And then we'll kind of go through a facilitated conversation where we review what has been put on the board, or on the wall, I should say, and make sure that the categories are shared. We have a shared understanding of what those are, that there's agreement on what those are, and then we will do voting with the green dots that you all have in front of you. So you each have 5 dots. They've got your initials on them, and they're all 5 green dots. So when we get to that point, and I'll reiterate this when we get there, but we'll have identified the shared categories, and then we'll give you an opportunity to identify your 5 or up to 5 most important categories for each commissioner. And then based on how many votes or how many dots each category gets, if it has more than 5 votes, it will become one of your priorities. And then we'll have additional discussion about what may have risen to the top, maybe what didn't. And if we need to have additional rounds of voting, we have different color dots that we can leverage at that point. Do want to, and like I said, I'll talk about this a little bit later as well, but just reiterate some kind of rules of engagement for this activity, which will become more relevant when we get to the dots. But each member can only vote for each priority area once. A priority area needs to have at least 5 votes, like I mentioned, to be considered. And you don't have to vote and use all 5 of your dots. So if you only feel passionately about 2 or 3 of the priority areas, you only have to vote with 2 or 3 dots. So I won't prescribe that to you, but just wanted to let you know that as well. Then we'll come back, have a full group discussion with our ultimate outcome of agreeing upon somewhere in the neighborhood of 3 to 5 priority areas. I do think, and I've reiterated this in the couple times that I've talked with you throughout this retreat, I think it's important to be targeted and focused with our priority areas, because the more that we have, the less focused we can be, the less we can kind of go deep, right? So I've heard from the board that you have a really strong interest in getting to outcomes, focusing on what we can accomplish, and kind of moving the needle. And I think one of the ways to do that is to be really focused in our priorities. So we'll kind of start with our initial reflection. So we'll spend about 10 to 15 minutes or so reviewing those gold sheets that we ended with yesterday. If you need additional, we have plenty. Yes, ma'am.
Oh, I just need them.
Okay, yeah, absolutely. Well, so once we finish, I'll have my team help me pass those out. So spend another 10 to 15 minutes reviewing those, and then kind of give me a flag once you're ready, and then we'll move to kind of sticking them on the back wall. I do want to make note for anybody who has things on the back wall that as we get to the point where we're putting the sheets on the wall, we may want to go ahead and move some of the luggage just out of the way just to make it a little bit easier to clear the path. But for now, I'll give you 10 to 15 minutes, and if anybody needs additional sheets, just flag me down, we'll get those. Yeah, so we'll pass some additional out to everybody.
Yeah.
Let me see what it is.
Oh, one second.
as many gold sheets as you want, and they can fit under these 5 category, or these however many categories, or they can be something different. What we're going to do is group them by kind of common themes, and at that point, we probably will vote on a theme or a sub-theme in terms of what our priorities are. It's not one gold sheet is going to win. It'll probably be a combination of gold sheets.
That's correct.
Does that make sense?
Yes.
Okay, great.
Thank you.
You're welcome.
All right, and just a quick check-in. We've got maybe another 5 minutes or so.
Can we start posting?
Yeah, absolutely. So if you're ready, you can go ahead and start posting on the wall. I would encourage you, maybe not for you initial folks, but for folks who go behind them and start posting once things are on the wall, start looking for maybe similar ideas that you can cluster together, and that will help us as we have our discussion. So feel free to start posting on the wall whenever you're ready.
Doing education.
Okay.
And if anybody needs any assistance, please let us know.
Put senior citizens up here. He's got it.
Haven't, let's give another 2 to 3 minutes, and then we'll start discussing each of our categories.
Okay, one of them, when we travel, one of them can come. I've already done.
Are you all better now? Yeah. You're back to
We don't need him no more.
You need to get a picture of this. Are we fighting over pictures? Right, pictures.
They keep.
Elaine, come over here, Elaine.
It's the 90s.
Hold up. Elaine.
self-organized too.
Ladies already had one picture. Look at all this. Getting late.
It should not.
My fan of white.
That's what you're going to be like. You know what I mean? That's good. Yeah.
Are there any themes with those?
Because I
I put everything on one. I listed everything. No, for environmental.
But we
I did.
all the seniors from that.
Yeah, that one. Yeah. I think that's me, yeah. Yeah.
That should not be.
Is that just, you know,
priorities, man?
Why have to be getting support for none of them?
I think you're gonna get
Certainly put them on the board for discussion. I get that.
come here.
Yes, ma'am.
So one year, George, we had dots with no name, and George put like 3 dots on what he wanted.
Then I might.
And
Oh, yeah, can't do that, George.
No, it's strategy.
So we're so creative. About putting initials to help guard against some of that. Maybe.
Making sure that.
All right, everybody. Let's start wrapping up, and then we'll start discussing each of our areas.
I want 5 dollars under all of mine.
Oh, that's nice.
No, I put up more than 5 then.
I did too. I put it
Can
more
only
than 5
do
too.
green.
No, I didn't.
All right, let's get them grouped up.
I've got to stop eating these.
Yeah, we don't care about that.
What did George do? We understand.
Put one on the fiscal.
Hey, we don't care. We don't care about that, man.
You can't tell the manager what to do and then not support it. I'm the only one.
We already have fiscal management. We don't need
all right.
that. We already got
Clean
it.
up. That ought to be a priority. That's all I'm saying.
We got 2 awards in terms of fiscal management.
Right. We're good. We're good there, man. It's
All right, everybody. So,
All right, Michael, go ahead.
all right. So what we're going to do,
Manager come in.
and we're going to start over here with Julia, and then I'll transition my way over here to this corner. But just by way of an example before we turn it over to Julia, so we're going to start with, it looks like our seniors bucket over here. Julia will walk through just kind of the themes that are on the gold sheets. We'll then ask, does this seem like a bucket that we want to consider as a priority? And then if so, great, we'll move to the others. Once we have kind of consensus around the buckets that we want to consider, we'll then move to the voting, which I'll talk about a little bit later. But I'll turn it over to Julia.
And I'll just add to that you might hear stuff in one bucket, and you can say, actually, I think it should be 2. Or you could hear 2 down the line and say it should be 1. So part of what we're trying to do is make sure that you have good buckets to vote for, okay? So the first one I have here is seniors, and 2 of them are talking about preparing for the silver tsunami so that we have the infrastructure in place that ranges from senior daycare and transportation to kind of food, adult services, critical home repair, housing. And so those were kind of the main themes around senior, in our senior bucket. Is that one bucket that hangs well together?
Yeah.
Okay.
Yes.
Yeah.
Cool. Okay.
All right. Well, I will ping pong over here. So we've got economic development here, and it looks like we've got 2 sheets. So the need to focus on underinvested areas also notes rising investments in MWSBE. And then we also have economic mobility, which includes economic development. So we also have some upward mobility type things over there. But it looks like 2 sheets here. So do we think that these should stay as economic development in this instance, or would we want to combine potentially with maybe upward mobility or workforce development, talent pipeline, however we might want to phrase that? But how do we feel about economic development as a category for consideration?
I wouldn't combine them until we read what the other ones are.
Sure, absolutely. Okay, that's a great comment. I saw a couple other hands. Same thing.
I think the same thing. Let's go through everything and then we can.
Absolutely.
Figure out where it links up.
Okay. So we'll bounce it over to Julia.
So perfect timing. I've got workforce development and upward mobility. And some of the comments were really about kind of strategic workforce development and economic development pipeline. So having people trained for I think it was the
Emerging jobs.
kind of more living wage jobs. and jobs where they can survive in this area. Another talks about internships in manufacturing for high school students. And then there are two that talk about this interesting idea of the residential upward mobility academy. So that's people living together, supporting each other. You heard about it yesterday. So those are the things we have in workforce development. Do they hang together as a group? Do you see any places where they should separate? Or do you want to come back to it?
Read them all and then start consolidating.
Right, so back over here with racial equity. So we've got several that all kind of touch on the idea of reducing racial disparities. So reducing racial disparities, reducing racial disparities. This one talks about the MWSBE policy, updating and upgrading technology, improving access and opportunity to close economic disparities, and then reducing racial disparities and promoting economic upward mobility, moving from 50th to 38th in the United States. We continue to lag in equity. So it looks like racial equity, there's some support here as well. But I'll bounce into Joel.
Okay, so next section I have is health equity and wellness. So there are a number of them that are focused on access to health care, especially for uninsured or underinsured people. A couple others talk about food security and managing that. We have funding MEDIC so that all areas of the county get equitable access to that. I don't know, that may fit with equitable access. We have two about mental health, better doing mental health, and then we have, that's mental health, and this is healthcare access. So those are the key ideas that fit in this one.
So we've got fiscal management. We heard a lot of talk about that yesterday, so we wanted to at least have it as a bucket. We've got one sheet here, so eliminating the funding gap without increasing taxes. Talking about allows us to focus on other issues that confront us. So that's fiscal management.
Okay.
Yeah.
Okay. So the next one is housing. And so we have housing insecurity, for three of them, housing access, which is similar, and then the access to emergency housing.
All right. And so we've got quite a bit here in environmental management. So talking about environmental stewardship here, the environment, green space, greenways, parks and preserves, farmland preservation, environmental stewardship, commitment to protecting natural resources, land acquisition for ELAP, before the build out in the next few years, environmental and environmental stewardship. So several different aspects of the environment here.
Okay, so next I have education. So one is education, because we're the funder at every level. One is pre-K focus, pre-K, and all education, including pre-K. So.
Okay. And then in our other kind of miscellaneous bucket, somebody's going to have to help me out with this one, but we've got develop a communication strategy based in how different demographics receive information, rising investment in MWSBE, economic mobility, childcare access, community support, adequate funding for IT and cybersecurity. The mystery one here.
Got a mystery one.
It looks like.
Who wrote? Is that you?
It could be youth.
Did somebody write down youth?
Youth.
Okay.
Youth.
Well, before we start clarifying, I just want to, RISING is an acronym, which my colleagues might not have heard before because it's new to me. It stands for Relieving Inequalities, Structured Investment, Nurturing Growth. And my understanding is that it's looking for opportunities to, you know how we do TIGs and BIPs and it often ends up in Center City. Whereas we've got University City, the Far East, the Far West, other parts that don't often get economic investment. And so where we can find great opportunities to activate. And, so that's what that acronym stands for. And that's the goal.
Underinvested.
Underinvested areas.
Absolutely.
Yeah.
Okay, so we've kind of covered, at least at a high level, each of these. Wanted to open it up for comment, maybe brief discussion on if anybody thinks that these are at least the correct groupings, whether or not the name stays the same, we can discuss, but or if there's any kind of collapsing expansion that you might want to advocate for. Yes, ma'am.
Should we think about upward mobility and include what Lee just said, and then there's something else over there about NWBSC, and there's something over there about under economic development, and then racial equity has some of that NWBSC. Shouldn't that be all under one?
What do you guys think?
I don't think so. I think that's a whole lot of different things, which.
Too many different,
Yeah.
too many?
Yeah, I think the things that are economic development at the end should go over here with upward mobility and, I mean, do you mind reading those again?
Yeah, absolutely.
See if my colleagues agree?
Sure. So we've got economic mobility, which includes economic development. It talks about assisting residents with upward mobility and getting out of poverty. And then rising investments in the NWSBE that we talked about, the need to focus on underinvested areas.
So in my opinion, that one, the second one you just read, is new. And there's another one here that says that. So I would move that one here, and I would move the other one there. That's my opinion.
Yep. Thoughts from the group?
What was that second one that you said?
Rising investments, the MWSB that the commissioner spoke about with RISE.
It's new, and
Yeah.
there's another one.
What
Absolutely.
category should it be? What do we name
It's
it?
under other topics.
I know, what do we name it so that it's something we can vote on?
I don't think we're there yet.
Yep.
Okay.
So,
Because we want to put them together someplace common.
And then the
Not-
upward
that's okay
economic
for me.
mobility goes
Yeah.
with upward mobility.
Yeah,
Julia, there you go. There's that one.
that.
You know, upward mobility is, you know, all of this.
Yeah,
You know, education is the key to upward mobility. Health and wellness is the key to upward mobility. All of this stuff is upward mobility.
'Cause I
So
can't
just-
get-
I'm
Speaking of,
Kind of all
we
over
also have
the
an
place, what did you
economic
feel
mobility here that will scooch over there.
No, and I think that's a good point, which you're bringing up. I mean, it's similar to the way we use reducing racial disparities as this cross-cutting
cross-cutting.
sort of factor, and with upward mobility being this ultimate goal, so
Housing, everything.
everything falls under it, yeah,
Education.
SRM.
But I think the economic mobility bucket, it should sort of be over the one that's over there. Like, I don't know why there's multiple that are, it seems like it's trying to fall under economic development, doesn't it?
What is intended, mobility intended for?
Say that again.
Upward mobility, is that for the community? Does that include the workers at the county?
It would include everybody in the
Everybody.
community. But
So
to
the
you-
county workers would be included?
Yes, ma'am. But to your point, Commissioner Rodriguez McDowell, you're saying move that
You hear that?
to here?
Yeah, like the economic development bucket feels like it's sort of an overarching bucket that includes upward mobility and MWSP. Like,
So why don't we do that for just in the time? for the
Mr.
time being?
Chairman,
I mean, you can move it for the time being, but my upward mobility is about money.
I'm coming to you,
I
Commissioner.
mean, that is the bottom line for me. is-
what did he say?
That's it. My upward mobility focus is about moving up the money line,
Exactly.
making more
yes,
money.
Yes.
If you make more money, you tend to be a little healthier. If you make more money, you tend to be able to
A little more
to
educated.
buy or live in a nice apartment, et cetera. So I don't know where that would fall in, but that's where I fall out on upward mobility. Maybe you guys can help me put it at the right spot.
Upward mobility is too broad.
See, Commissioner Lee, what was your comment?
I was agreeing with Mr. Griffin when it
Uh-huh.
was mobility. I was asking, does that include our people who work?
Absolutely. The
So they're
counties, yeah.
included in this
Yes,
upward mobility
and everybody
themselves.
that lives in Mecklenburg County, to your point, would be included in any of these discussions.
Thank you.
Everybody, yes.
Well, upward mobility with education for staff.
And so I will say, as we were conceiving of these initial buckets, we were drawing a bit of a distinction between economic development, maybe more at exactly, the investments at community level, and maybe some of that, maybe workforce development, upward mobility, talent pipeline type things, which might be more individual. That's not to say that we can't combine or anything, but just wanted to share that additional clarity.
No, and I think that's good. For me, when I propose economic development being a priority, it's distinct and apart from upward mobility. I mean, I guess you can make a tie, but when I'm really talking about specifically investment with how we leverage economic development with respect to investment. How do we leverage our land? How do we go into these deals to support, open space? And, you know, the project that we just did is a perfect example of what I mean about, investment in economic development with, what's the name of the project we just did? Providence Square. That one. So it's just different for me.
And so I do also want to share, so, you know, beginning with kind of where we're ultimately going, right? So we're going to have priority areas, and we're going to attempt to identify different focus areas within those. So it could be that you have, just for talking purposes, maybe an upward mobility bucket, and then we could have different potential focus areas under there that could align to different budget priorities, which would allow us to potentially align to different KPIs to measure impact in different spaces. So it sounds like we've got a healthy amount of discussion and activity kind of in that upward mobility space, but then, at least right now, our economic development bucket is a little bit empty, but maybe that's, the MWSBE type stuff might be more economic development in that respect. Yes, sir.
So when I look at economic development, what I'm really looking at is, what is the return to Mecklenburg County? And oftentimes, we have to make an investment to generate the return. But it's really about the return, because what that does is potentially it increases the tax rate to help prevent us from having to tax the citizens to do the same things that we want to see done.
Yeah, my upward mobility is more focused towards individuals moving up. The other economic development investments is helping the community move up. You know, in terms of putting capital investments in a particular community, like the corridors of opportunity, where if there's some mid-sized mini businesses or something that we could do to support that community's moving up, is how I differentiate the two.
Susan had some, George.
Yeah, I think that, for me, maybe upward mobility could be the overarching over economic development and rising MWSB and things like that, because when we are in economic development, we are focused on bringing jobs, like that's one of the reasons, and making sure that there's room, or always trying to, we're always looking to see if it's a place where you can move up within the company, and, like there's, people are getting the right SOCs, and, like making sure that they're getting the right wages and all that kind of stuff is part of our economic development lens. But I can see, for me, it's always been about upward mobility. So maybe upward mobility should be the overarching bucket, and then economic development falls under that, and rising MWSBEs is more of an individuals who own businesses, but it doesn't necessarily apply to everybody else who doesn't own a business. So anyways, I just offer that as a possible overarching.
Cool. George, you had something else?
No, because I think Susan is right.
Well, I want to speak to that. When I think about our priorities, I go back to what the manager told us with respect to, these are areas where we will focus more funding, and my words, not hers, but essentially all these areas where we develop a strategy. Why I'm trying to continue to advocate for economic development and the concept of rising is because there's a lot of times in the community what I continue to hear, and I think others have as well, is that there are too many areas that are underinvested. We don't have the programmatic structure to support smaller entities that will go into our underinvested areas. So it's going to require a lot more support from us, from the county, to get to try to spur economic development in places where some of these folks won't go, like outside of South End and uptown. How do we get people more investment on Beatties Ford Road or on Central Avenue or South Boulevard? We're going to have to really be strategic about saying, hey, we're going to come into these deals, and it will create the upward mobility that you're speaking about. So that's why I'm really focused on that. It's not just for the big deal, so to speak, because I think we already have, you know, a mechanism for the bigger deals, but it's to spur investment in those underinvested areas. So that's just a
So what do you
thought.
mean, Mark? Can you just say, like, so what are you saying? Like, like, what does that mean? Does that mean you don't think upward mobility is the overarching? You think economic development is?
No, I think,
Or it's two separate things?
I think it could be, upward mobility can be overarching, but I'm saying economic development to me should be a priority. And when you talk about, Leslie, Dr. Johnson, can you remind everybody what the acronym RISING means? What it stands for, excuse me?
Make sure I say it correctly, because it's a mouthful, what that is. It is,
Can't hear you.
Oh, she's got it. We've got it right here.
so what I would say is relieving inequalities, structured investments, nurturing growth.
So when you talk about relieving inequalities, right? I think right now, a lot of developers in our community, smaller developers, don't feel like they can get in the game with support, and they're the ones that primarily are willing to go into, sorry about that, are willing to go into some of our invested areas. So I'm advocating for,
Speak up a little louder.
sure, I'm advocating for a specific focus with respect to economic development in areas that are underinvested.
For example,
For example, Beatties Ford Road, South Boulevard, some parts corridors of South Boulevard, Central Avenue, places that, again, outside of just uptown or South End, where people can take advantage of some of the structural support that's there. Yes, sir.
You know, I was just thinking about what Susan had said earlier. If we had like an overriding topic where those two things could come out, would that be confusing to the manager in terms of how to apply resources? If the manager could figure out how to do that, because I like both of them. I like the investment piece and as it deals with inequalities, but also like the upward mobility. So if we funding, big dogs don't play in terms of investment, but also like the upward mobility for the individual piece. So is that confusing?
I mean, the economic development piece is crystal clear. Investment in underinvested areas,
Thank you.
that's crystal clear.
Thank you.
Economic mobility, I think we just need to put a little more meat on the bones there, so we really know what you want to do.
All right, I'm sorry I had to leave the room, but what I really wanted to know is, did somebody define the total number of focus areas, or are we trying?
So I think 3 to 5 is kind of what we're aiming for. So just to bring us back, so what we're doing right now, we're not necessarily voting on as a priority. Potentially, to the manager's point, with some more meat on the bones, potentially economic mobility as something that could be considered as a priority. I also want to this conversation about upward mobility or economic mobility being kind of an overarching umbrella. When we work with our departments in strategic business planning, we talk about goals being kind of this umbrella term or umbrella bucket, that, if you will, and then we get more specific with focus areas or objectives or strategies to really get down into what's important, right? So like, if the board was interested, we could do something like economic mobility or some umbrella term with specific focus areas underneath. That, I think, would help us to align to department plans. It would help us to align with some of the data that the board would be interested in. I think it could certainly help with budget alignment as well. So I just wanted to share that bit of clarity, but I'll turn it back to the board for further discussion.
Can I finish my
Yes, sir.
my concern? My concern is that if we're going to limit it to 5, it might be in our best interest to combine even more of them.
Right.
Because if you don't, it's almost as if though things that people said are a priority are not of interest or not a priority. So we're either gonna have to work harder to combine some, or, well,
Can I speak to that?
yeah.
Okay,
So it's Altman, Elaine, and then Arthur.
So, I feel comfortable going out on a limb here and saying that I expect this board will unanimously support continuing reducing racial disparities as a cross-cutting measure consistent with the leading.
Support what?
Reducing racial disparities as a cross, the Leading Opportunity Task Force advocates using that as a lens in all public decision-making. And so I think that towards, to the Chairman Emeritus's suggestion that we try to combine and reduce, if we can take reducing racial equity off just because we know that it's going to be on the right side, applying to all of our priorities. So if you can take that off the wall, knowing that we're going to have it apply to everything. And respectfully, I would suggest we remove fiscal management because this board has unanimously voted to task the manager with coming back with more cost-cutting recommendations than she's ever done in the past. I think we've already checked that box, so let's take that away.
I'll accept that.
Okay. All right. So now we've got, we just winnowed, and now what I would recommend is I can try to clean up workforce development, but maybe I should be quiet and let someone else talk for a minute.
Well, let's go with Elaine and then Arthur, and then we'll come back to.
I was just gonna say, we currently have 6 priorities. Everyone keeps saying 5, but we currently have 6. So, we can still have 6.
5 was cost cutting.
Good point.
That was it.
Thank you. Arthur?
Yeah, I just want to say for the manager, in terms of workforce development or upward mobility, the ability of an individual to move from a higher to lower to a higher socioeconomic status, typically by advancing in their career, increasing their income, or improving their ability to move up the social ladder. I use your example that you gave us in responding to the questions from Central Piedmont, a high school graduate in 2019, went through a program, apprenticeship program for The Rock, and is now making $70,000 a year. You gave us that example. That's what I'm looking at in terms of trying to figure out more ways of grabbing folk at a certain point in their lives and providing opportunities for them to get to $70,000 as an individual. So that's what I'm thinking about when I say upward mobility.
I think that's great. I guess that one example, I guess what you're saying is the county funded them to go to the Rock? So funding programs like that, because that would be the only way we could influence that outcome.
That's not that we.
I just want to be clear on what the expectation is.
Yeah,
that's all.
right. Yeah. That we provide the yellow brick road for youngsters like that to follow to get to $70,000.
So does that mean that the populations we currently work with that would not be necessarily able to get? So for example, to respond to what the comments that you gave us earlier about the $18, $20 an hour jobs, are you insinuating that we would stop doing that?
That would not be my priority. Would be focusing on getting to the 60 and 70,000 year job.
So that would be something we would cut, then we would refocus.
I'm one of 9 to suggest that.
I just want to make sure people understand kind of how we're going to think about it.
Yeah.
So
it's tough, Dina, for some folk to be hard-ass in terms of saying, hey, this is not working or getting us where we want to be. It's not tough for me because in every indicator, institutionally, there are African Americans on the bottom. Despite our best efforts, they're not moving. And so for me, it's reflecting on 1968 when African Americans were at the bottom in health care, jobs, wealth, et cetera. Let's figure out how to provide a yellow brick road to move those folk, if not others, out of that bottom ring.
That's right.
So I've got a couple of things. When I look at what we've got on, up on the wall, several of them match our current priorities. when you look at, I know he's put environmental management, I'm just gonna say environmental stewardship. You know, I don't think that there's any reason to change the name of the focus personally, but, so I'm just gonna say environmental stewardship, education is there, housing, health, and then workforce development. Those are the current ones. Reducing racial disparities, obviously, is our overarching lens. And to me, just on a personal level, I think economic mobility ties into all of these elements as a sort of a more overarching. Economic mobility in and of itself is another overarching cross-cutting factor that we want to apply to whatever the priorities are. I don't think
it's an outcome of these
I
things.
don't think it's a separate one, because it's hard for me to back into a dollar amount. What is that, what are the dollars that we're gonna fund to go in? I mean, it comes into all of those buckets.
Exactly.
Could you do that, so.
I'm curious, though, with that distinction, most of the things up here in the upward mobility or economic mobility area there's a bunch of workforce development specifically. So that's not overarching, that's a piece, just like housing is a piece and so forth. So are you suggesting we get rid of this bucket, or?
Well, if it's gonna be, so to go to Commissioner Griffin's point for just 1 second, the example that he gave with the rock, that would fall under workforce, right?
Right.
I mean, if we're gonna do that, then that would fall under workforce, but I'm saying it still does not negate the fact that we're talking about upward mobility.
Right.
So maybe it is this idea of talent pipeline, and I'll let Commissioner Altman speak, but maybe it's the development of talent pipeline, but having the overarching goal of upward mobility, so.
Thank you. I'm just going to turn around so I can talk in a microphone so Commissioner Lee can hear me. So, and I'm going to call on you, Mr. Trotman, because you're really the expert in the whole field. When we first started talking about workforce development, I'll speak for myself, I didn't really understand that the term workforce development is describing the most challenged sector of the labor market with multiple impediments to employment. Okay. And that is an area that there are a lot of providers on. I don't think it's a goal for Mecklenburg County to reproduce that infrastructure or duplicate what's already being done out there. That's not a good use of our money. But I think that there's a larger ecosystem that nobody is effectively leading, even though maybe they're supposed to be, but that we, even with our efforts in the last 4 years, have really driven the discussion in constructive ways. And so can you talk about the difference between workforce development, talent pipeline, and where you might see the gaps to help us understand how we can have the most value add? And by the way, I did not prepare him to answer this or tell him I was going to ask him.
No, you didn't. So I think over the last couple of years, it's something that the CELC, Charlotte Works, City of Charlotte, and Mecklenburg County have been, and CPCC have been at the table to try to figure out. Now it's including Alliance as well as our economic development teams, both with the city and the county. And in my conversations with you, you are wanting to anticipate opportunities that potentially will be down the road, and how do we prepare our students? How do we prepare our workforce for those opportunities that have not been developed yet? Because when jobs are developed, when our economic development teams do identify opportunities and businesses to come to our community, many times our residents aren't prepared for those jobs. And that's been in my conversation with you. And so how do we anticipate those opportunities and then prepare our residents for those potential opportunities? And that's something that we have been grappling with in conversations. As you pointed out to me on a couple of different occasions, many of these companies that come into our community have to immediately recruit outside of our community because our residents are prepared. Am I correct?
I mean, that seems to be, yes, what Mr. Griffin's referring to also, that we want our residents to know what's coming and for there to be alignment between our education center, our training centers, the people who speak for these industries, employers, and government, so that we can have a true talent pipeline, so that, to Commissioner Griffin's point, people are going to be knowing about the new jobs that are here and the new jobs that are coming so they can prepare for them. And for this to be in the hands of everybody, not just the people inside Charlotte Works, but across our community, because our community doesn't know any of this.
Right, right. So,
Yeah, just to add on, it's not just the jobs that are going to be coming in. Certainly that's a focus. But I passed by places, Siemens, welders needed, machinists needed. I mean, there are corporations, Croninger Industries right now looking for folk, but the challenge is trying to get a pipeline into current well-paying jobs today, as well as preparing for the influx of new jobs and skills coming in. Siemens is begging for welders. And CPCC has a program for welding. Maybe we can support, Dina, CPCC to provide the skills training, the reading or whatever that's necessary. Because once you finish CPCC's welding program, there's one block there. You gotta pass the state licensing exam. So I think there are opportunities for us to support organizations like Central Piedmont and others who are doing workforce development to make sure some of these youngsters get over that hurdle to be able to be a welder or to work with the construction company, that example that you gave us from Central Piedmont.
So when you say support, what does that mean?
Please, I'm just dying, if I may, please, Mr. Griffin. To my knowledge, we had one slot in the county manager's office for workforce development. For 4 years, it hasn't been filled, y'all. So, I'm not looking for us to develop a lot of infrastructure or spend a lot of money and have a lot of slots. I recall ACM Johnson saying in economic development this past September, there's not a single person in economic development whose job it is to work on workforce development. So, there's not a lot of infrastructure that I think we're trying to build inside the county, but I do think we need, Mr. Topman is busy. He's got a lot of different things to do. We don't have a single person whose sole focus, sole area of expertise is helping us to provide leadership to a fairly disjointed ecosystem. And it is so seminal to everything else we're trying to do. Thank you.
Commissioner Meyer?
Thank you. But don't we support organizations that do just that? Isn't that?
Well, when he said support CPCC, does that mean we're just going to give them more money?
Right.
I guess I'm trying to make sure that, you can say it, but we have to operationalize it. And when you start getting into your aspirational goal setting, you have to start thinking about what success looks like, how we're going to measure that, and what is the expectation for the staff that have to work on it. So when you talk about this position, which we still have never been able to figure out how to build that out, what is the expectation and what does success look like for that position?
So I think that's, to answer your question, it would be an Aaron Stanforth.
But what is success look like?
Success looks like every parent, principal, pastor, rabbi.
How do you measure that?
Being able to articulate who are the hiring employees, who are the hiring industries, what skill sets. I still can't say what that is for this community.
But I think Charlotte Works already does that. So, those are your priorities, but I just want to make sure that we manage expectations in terms of what you're going to be expecting the team to do.
I feel like if we do that, what she's asking is we're reinventing the wheel because Charlotte Works already does that.
Well,
that's my question before.
Well, and I think your point about people relocating to Charlotte and bringing jobs here, if you remember, our friend from UNC Chapel Hill, he said the number one reason why people move to a location is for the talent pipeline. So these businesses already know. So when we say that our residents aren't ready, I don't know that that's necessarily the case because they're moving here knowing that their pipeline exists or they wouldn't come here.
But
So
we
there's
also,
a disconnect for me in terms of the problem that you're trying to solve.
but we also know that 50% of the people moving here are foreign born, so we're importing a ton of our talent to fill these new jobs. You know, Charlotte Works apparently just got around to being able to convene all the providers. We heard from Ms. London that she finally got them all in the room. That's like 4 years.
I think that's another part of the conversation is that, and others have tried and failed numerous times, is you just cannot stand up and raise your hand and say, I anoint myself as the person who's going to take this on. The city of Charlotte tried that with Hire Charlotte. It was an unmitigated disaster. The CELC tried it with the Radius Group project. It was an unmitigated disaster. So I am very cautious about stepping into something and anointing us as the one who are going to fix it when you've got to get all these other people to agree that, yes, Mecklenburg County is the lead and they're going to fix it. Because, Anthony, help me here. You've lived this more than me. I'm just being honest about it. I mean, we've watched this for 4 years to see how this has gone, and it's just recently that everybody has coalesced around the view that Charlotte Works should be the lead. And everybody's bought into the fact that Charlotte Works should be the lead. So Mecklenburg County coming, go ahead, I'll let you talk.
Well, when you said the 4 years, and then Dina talked about those different initiatives being a disaster, that's been the holdup over the last 4 years. It is because of all those different presenters coming to present to the board to say, we're working on these various projects, and then we'll come back to you with an outcome, and it never worked. And so it didn't make sense for us to add another body to the conversation until we saw the outcome of all those various initiatives. So that's kind of where we are. And so we're at a point now where we are regrouping as an overall ecosystem with the CELC and Charlotte Works. And we are a major player at the table, as you know, but really defining kind of where we are going. I think is an opportunity for us because, like many of the board members, you are asking the tough questions. And then after you get that answer, then you ask another tough question and another tough question. So it is difficult to kind of like figure out what is the true outcome we're trying to achieve sometimes. And it's something I think we can work with you on to figure out. But truly seeking to understand what everybody's doing, I think, is the first priority before we add another piece to it.
Let me go with Arthur, George, and Susan.
I fully support what Lee is suggesting. Dr. Allen, who used to be working with the county, my first or second retreat, I fully support what Commissioner Altman is saying. And Dr. Allen, during my first or second retreat, it just sheared in my brain. She said, and it's in our Pulse report, that we in-migrate our talent, okay? That talent is coming from outside of Mecklenburg County. And so I don't know whether that was accurate or not, but it's in the Pulse report. And just common sense driving by Siemens and other places where there are job openings now. People are moving into Charlotte with a certain skill set to get some of the current jobs that are here, period. Now, I don't know to what scale, but this is just driving by and talking to people. People are getting those jobs. When we bring in entertainment industries, the Panthers and Hornets and soccer and more Family Dollars, they're going to get those low-wage jobs. And I think the emphasis should be on living wage jobs, and we need to figure out how that rolls out. And I'm willing, County Manager, to get with you after today and see if we can make a structure that makes sense to you, that we can accomplish that. It is not happening now in terms of those living wage jobs coming through the pipeline. And I think Charlotte Works been working on this for how long? For at least a minute or two. And I've talked to Anna too many times. I don't even want to talk to her anymore about Charlotte Works. So something else needs to occur, or Charlotte Works needs to change what it's doing.
All right, George.
Okay, so we've heard from Anna recently. We heard the manager ask the question. And she's not disputing what you guys are saying. And nobody's been able to answer her question. The question is, what would success look like? Because we're going to hold her accountable. We're going to go say, either you did this or you didn't do that. If success is making sure that somebody who's a DSS client ends up with a $70,000 a year job, if that's what success looked like, say that. But what she's also, well, she hadn't said it, but some of you said, Charlotte Works is the organization that you refer that person to get that job. And it's almost as if though, well, Arthur basically said he don't want to hear from her again, but it's that you want to go around the resource that we're telling you is available to accomplish what you want to see. I mean, and either you want to see that outcome or you don't.
Thank you. We're going to go to Susan and Yvette.
Thank you. I just feel that, education is under-resourced in North Carolina. But CMS is under-resourced. And if we could focus on funding education properly, our public education, pull funding from other programs that are not public education, if we have to, and give it all to CMS. They have CTE, and they have other pipelines, but they need to be fully, consistently funded. I mean, the teacher shortage is real. If you're saying that our people aren't prepared for jobs and they're coming out of school, out of public school, not prepared, well, then we need to fix public school. And the way to do that is to have teachers to resource the public school system. And so I just think, talking about other ways of creating a workforce, that's the main way. And I just think that the programs are there. They just need teachers and funding and consistency. And I think, for me, that's the answer.
Okay. Yvette?
So I agree that we need to fund schools, absolutely, but I think that's kind of like, it's a little, we need to dig deeper. It's one of the prongs, but being someone who can empathize about that whole workforce development and job thing, and my son and myself and everybody else, it's almost like the same thing with, workforce development is just like CMS. That's the tool that we have. They're not producing what we need them to produce, but we don't have any real control over that, right? We have to fund it, but so in us determining what economic mobility would look like, we have to define what workforce development should look like. And we need to go to the agency that does that and tell them what that needs to look like, what success needs to look like, what Dina said. So, all of these are, there are multiple prongs to it, and I think it would be naive to think that, if we just focus the money over here, it'll all get better. It'll come. If you build it, we will come. There's got to be multiple angles that you approach it, and you have to first start with, who do you want to do workforce development? Are we going to have multiple entities doing workforce development, or are we just going to have one entity doing it and doing it correctly and telling them what needs to be done, what success looks like?
Thank you. Commissioner Leak.
Thank you. I'm a newborn baby, and my parents send me to school. But my parents are not educated, but they see people driving nice cars, living in these homes. So they say to Johnny, Susan, we're going to try to send you to the best schools we can. Why? We want you to be economically successful. best college, the best girl on the block, a decent man, so that in society we will say you've met those goals. So this is what happens in America when we talk about economic mobility. Education has to be the key.
Yeah.
Environment has to be the next part of that process. So when I look at it and I hear parents, and I remember growing up myself, the first thing I heard was you going to college because we want you to find a good husband. Or that was said a lot, going to medical school. We want you to find a doctor, but not just a plain doctor now. He has to specialize so that his income will be greater. So there is a set goal for you, with you, through the community that will provide those resources to help you to do that. And education is a base for us as black folk. That's a fact. So I'm saying to us that we have to look at it both ways. I remember Dina coming down the hall. Can't ever forget it. She didn't apply to be the manager. We hired her. So I'm saying to us, is what you put in the cake is what you get out of the cake. And a lot of people move here because they hear they're great jobs, tall buildings, nice apartments. So it's economics and it's education. So that's where I fall with a professional football player. They start him out, and then they take him around, and the parents make sure this is with the right team. That's what you look for. Am I right, son? That's what you want for your daughters.
That's what I want.
Economic security. Am I right?
I agree.
Thank you.
Yeah, thank
But
you.
at least have a decent background and not be a wife beater or,
So-
that kind of thing. I'm just saying those kinds of things. You want the best.
So let me,
Chairman Jarrell, I want to be,
give me 1 second, Deputy County Manager. I apologize. I want to pull people back now, right? So just, go ahead, finish your thought, and then I need to tie us back, because basically, we got the same priorities up here with the exception of two. We're being too cute by half at this point. Everybody's got a chance, the opportunity to say
Let's
what they want to say, which is good. We wanted this level of discussion. But essentially, it's the same priorities. I think the challenge is, how do we change the focus and give staff the right direction? But go ahead, Deputy County Manager, I'm sorry.
no, I just want to be fair to Commissioner Altman. What her vision is something that's really never taken place in the country.
Sure.
Being active with NACO and several of the other national organizations, which is part of the struggle because it doesn't exist. Really pulling together the education system, workforce system, and economic development system, and having some person like over all of that to drive change that doesn't exist in the country. So I definitely recognize why it's a struggle to truly articulate what it is. And I get it. It just, it's difficult to define an outcome when it's never been done.
No, I think that's a fair point. Here's what we gotta focus on, team. We could get to the micro, or we could stay at the macro. I'm asking us to get to the macro for just a second to look at what the overall priority is, right? And then we can drill down and have these discussions on, the micro programmatic elements, right? But look at what the buckets are, and that's what we got to solve to.
And to get home before dark.
And here's the other thing. Go back to the slide that showed the investments made in the board priorities. You can tie it back to dollars. If we can't tie it back to dollars, how are we going to measure and say to the community what we've done? And so, when you take environmental stewardship, $437 million, health access, $263 million, and so on and so forth, that's what we've got to be able to tie back to. So in this area of workforce, it is already a priority. Now, how we want to frame it or how we want to shift the direction, I think we can discuss that. But if we agree that overall, it should stay a priority, we should continue to fund it, then, I mean, that's a decision that we're trying to make. You're the expert to help us get to what the architect has designed, and then see if we will support that. But when we look at this, I mean, we got to get to narrowing these buckets down more so than just going into the programmatic details at this point.
Mr.
We
Chairman.
get there. Yes, sir.
Chairman, we don't necessarily have to narrow the buckets down. We could go back to the process that was initiated, which was we vote on 5 and move on.
Well, that's what, I mean, well, I'm saying it differently than you.
So, yeah, you're-
I'm not saying narrow, I'm just saying, just choose the,
Okay, so if
We
we're
have the
there,
buckets, yeah.
if we're there, then we can go cast our 5 votes.
let's let
I
Michael
think,
take over.
I think what was happening was that people were trying to figure out a way to encompass everything that's left up there into the 5 buckets. But we've been discussing that for about an hour now. And
No, we're done with it. We're done.
so we can just cast our vote.
We're done with it.
So I think to that point, this conversation I think was helpful. We were trying to make sure that we had shared understanding of what the buckets are so we could get to a vote. I think based on the conversation, I think there is understanding of kind of what each bucket means. Now, I think session 3 that we'll move to in a bit will help us further operationalize that, to the manager's point, about understanding what we should focus on, what does success look like. A lot of this kind of programmatic conversation, certainly, absolutely, the goal setting. And so I think if the board is comfortable, I think we are at a point where we could leverage those green dots and do vote. Yes, ma'am. I'll turn it to you. That's your job.
All right, so we're going to cast the dots.
And so just as a reminder, each member can only vote once for each potential priority area. And yes.
What about this?
So
We
we
could
do have-
move these, or they need a title so somebody can.
So my recommendation to the board, and certainly open to your feedback, these are all different. And so, I mean, we've got youth and childcare, that's potentially aligns to our early childhood development, but the others, communication plan, community support, and then IT, we could break those up into separate groups if you'd like, given that there's only one
You
sheet
can put a
per.
dot on one of those things.
Yeah.
If you like that. If you want one of those, just put a dot on there.
Yeah, so we've got,
Yeah.
then for youth, looks like this looks like community support for youth,
But we're gonna lose a priority.
and then childcare access.
Mr. Chair, you could give the people who put in the other category an opportunity to move it where they
To
think it
another.
might go, given the discussion that we had.
Does anybody want to move, anybody that put something in other, do you want to move it to another category?
Sure. I had childcare.
Where do you want to move that?
I just moved that one right there.
Education, put it in education, because we have early childhood, pre-K.
Yeah, I suppose that could work. I mean, are we just basically doing our same 6 priorities with different names? Or if we're eliminating one? I'm not quite
Doesn't mean
clear on
priorities have to change.
what the buckets are.
Well, there's an additional one that's added, which is seniors
Yep.
Seniors and economic development.
and economic development.
The way we did yesterday, when we were in our small groups,
Right here.
all they did was come out and try to come up with the major themes. The major themes happen to align with where we pretty much currently are right now. And so if we want a different, we could either eliminate or add. Go ahead.
Well, I would personally say to change the workforce development one to economic mobility.
They're already together.
Yeah, we already said that.
So, but if we're looking at, because if I've got 5 dots and there's 6 buckets already on our previous, like on this sheet that shows our totals, if we're not wanting to change away from those, like we need to understand, I feel like we need to know what the buckets are before we can vote with our 5 votes.
Right.
So would it be helpful for the board if we reviewed again what the buckets are?
Because I just feel like there's too many, yeah.
Well, like it's senior services, which is so needed. Is
that
that
under health?
Is that under health? Right, or is that its own bucket?
Some things aren't
I would vote for senior services. in a heartbeat.
It's a new category.
Right now, it's under its own category, and so if it get 5 votes, it becomes a priority.
Becomes a new priority.
But then you have to take away one of our old priorities.
Well, one of them's gonna fall off anyway if it doesn't get 5 votes.
Yeah, I mean, we've changed priorities before.
Yeah.
Yeah, I guess, we don't have to hold to the same priorities, or we can. We don't have to hold to the same priorities.
But they don't get unfunded, correct, if we don't? Just want to make that clear again.
They would be baselined, and they would be
Baseline.
funded to the extent they could be at the same levels, but depending on how much money we had, if we had to reduce, it would be under the ones that did not
Okay.
rise as a priority. I mean, it really depends on how much money we have.
Like early childhood development isn't up there, but that's one of our current priorities. But it doesn't have its own category up there.
Yeah, it's with education.
It's with education, which is a different priority
different priority.
in our
So-
current priorities.
So then, if we're combining those, why are we at more than 5?
So just as a point of clarity, so under education, we do have public education, we've got early childhood, looks like child access, pre-K, education including pre-K, then pre-K as well. So yeah, it looks like right now there's one kind of general umbrella that could have potential focus areas of funding education, working on childhood or child care access, MEC pre-K. So it could have education potentially as a bucket with potential focus areas underneath. Or if the board would like, we could break those out for consideration as education and educational development.
I just feel like we're taking things, putting them in buckets, and they're not
I don't
focused on
I don't
them.
want to take away early.
Because there's 6 priorities.
priorities.
So Susan, I guess, so everybody can make, so we can make this easy, right?
Yeah.
If you want to advocate for a priority that's not up there, we can do that. We could just say, if you say, hey, I want the board to consider early childhood education separately, even though it's not there, because it's one of our current priorities and you want to keep it, just say that. You can add a column and we can put dots there, right? Or we don't have to have 6. We could have 3 if we wanted to. You could have 5 if you wanted to. If you wanted 7, we could have 7. We just need more dots. We wouldn't advocate for that. Saying yes.
So if we add, say, childhood development to education, aren't we just diluting a bucket? If we just keep adding under umbrellas, and we're diluting that, aren't we, Adrian?
Well, I would say this, and I know Michael may be able to articulate something about it too. The broader your categories are, the more difficult it is to determine strategies that you then invest. So if you've got categories that are like just quality of life, well, what does that mean? What do you actually want us to invest in? And so that's something to think about.
Yep.
Kind of like economic, what did you say, economic mobility? That's huge.
Yes, that's right.
That's enormous.
Do you want to and say you want to add a bucket that says early childhood education? And we can vote, right?
So moved.
Is that what you're saying?
That's fine. Yeah.
Yeah, so he can put that there, and then every category that we already have is up there, plus 2. Plus seniors and economic development. You don't have to vote for all of them. You pick the ones that you want, and the highest votes will be our priorities. Is that?
We got
We're
it.
not?
We got it. We got it.
Okay, well, let's roll.
Okay, so everybody has their
Do we have
their
enough,
green
do
dots?
we have enough dots?
Yeah.
Got
we
5
got
each?
5.
So
what?
we were intentional about limiting to 5 dots because we were trying to focus on the 3 to 5 priorities. To Adrian's point about, if you have a lot of priorities, then we're unable to focus. So,
But we're the board, we can have 5.
We can have 6,
but the
right?
board, would you all like an extra
But
dot?
you
Yeah,
muddy-
everybody
you-
needs extra
you-
dots.
But if you do that, you're muddying the water. Because the bottom line is, you're trying to get, as I understand it, you're trying to get to 5 priorities. What it appears to be is that nobody wants to lose out on priority.
That's what it is.
But you had the option to combine some things under 5 priorities. So let's just vote.
Thank you.
Yeah, oh, you can keep, we can keep the current priorities if we wanted to. All right, go ahead.
Put seniors.
Well, we can have that tab. Keep current priorities.
You want to keep the current priorities?
Yes, so as you're voting, if you could put your dot on the actual label, the page at the top.
And this for education, huh?
Okay.
What we doing, we spending our money now?
Yes,
Yeah,
sir.
yeah. Make a choice, make a choice.
Spending money.
Happy to help.
Mike, did you get? Oh, we were just saying the 5. You did the, you got the early child.
Yeah.
Okay, good.
Seniors, seniors.
I'm getting senior.
5, Max, what's her name? Susan.
Yeah, excuse me, I'm sorry.
Don't forget education now.
Oh, I just put it.
That's health and wellness.
Oh, I did education already.
All right.
High five?
Oh, I'm sorry.
Economic
You let me
development.
have
The whole
it?
economic
No, I can't do
development.
nothing, not after today, baby.
All right.
She only wants to vote for 2.
Excellent.
We can at least talk.
Thing on the end there?
That's seniors.
Did you put seniors for your parents?
I only have one parent left.
Put down there for your dad or mom.
No.
There's plenty of.
That's right.
Plenty of.
She got some.
I'll turn around when you go.
Oh, we got to take care of her.
No, that's okay.
So we're narrowing it down to 5.
I guess it's expensive enough.
So it looks like we got one that had, yeah, I mean, that's
Hey, Laura.
Yes, sir.
Early childhood could go into this
I would think, but
education
I
bucket.
Did you put environment?
Did you know you were senior?
My
I am.
question was, is it diluted everything and everything gets spread out?
Did you want me to put your sticker down?
I mean, but
Yes.
it would be different.
Ask Kia to cut the piece
doing
when they're
education
looking at the
first.
program.
You still have 3 stickers.
Because I'm
Me?
It's both.
It's
both.
education in general.
Education in general, right.
You want me to take one?
Education.
All right, I will do it.
You guys killed it yesterday. Don't be surprised.
What did we kill it? What did we do?
You said no. You said we were taking too much money from other things.
What type of, so, will we do it, or we ask departments to get it first up?
Workforce, seniors. You want on seniors. You got it.
Yeah, I guess they got some.
And my small business coming back.
Yep, you got it.
That's right. Got 4 black women.
Exactly, we beat us, killed it, environment.
And thanks for your comments,
So did we get 5?
because you were part
We got 5, we narrowed it down.
environment, education,
The
health, equity, and wellness.
We gotta figure out,
Like,
we still have to reduce the
That's
racial
kind of
disparity.
oh, it's gonna be a cross cutting.
Sure, that's a given.
Yeah, okay, yeah.
We can, let's vote on it out loud, though.
Yeah. All right, bro, we got it. Dang,
Okay.
y'all killed my housing,
Right.
man.
Not me.
Y'all shot it down?
What did we
Man,
do?
everything.
I put housing.
Like,
I voted housing.
I'm like 0 for 2. I'm like lost economic development, housing, everything.
Commissioner
Don't
Griffin,
forget your mama.
you put
Wait a second.
I'm
I
leaving.
said we should have done housing. Remind me what we did.
Yesterday's conversation.
I could spend my money to where I want to spend it.
well, sort of. You can spend it in the same place, though.
Do you have to be?
So you got one back.
You try to put 2 on 1.
Don't look at me.
That's why they didn't give you
I already did housing.
Put 3 on 1.
They did look happy.
You can't put 2 on Arthur Griffin.
On all these dots.
Arthur.
Oh my gosh,
Arthur Griffin, credit out.
Hey, Arthur.
What you did?
It's what the building is
The thousands on.
Not large enough for it.
We have to do
well,
housing.
man,
It's over, man.
Ken has got her thing, and we already fighting with people.
You don't have it.
I've gotten 2 complaints from
One in
folks she's
Thank you.
got.
I don't understand housing, y'all.
One she told me yesterday, days ago. They've done a good job. These are all my best
Makes
friends.
sense, given the stuff that's in there. 7. We got a bunch of 5. Well, that's a 6.
No, I'm being honest with you. Yeah.
Oh, yeah, that's a 6.
Okay, so we got a 7.
Rocking it out.
Has everybody finished voting?
No, it's
Has everybody finished voting?
No.
it's bitter.
Over housing.
You got, okay.
I'm trying to figure out where I'm going.
Seniors are off. But in education. Well, that's enough to
Yeah, if there's somebody in age.
I don't think I say 2.
Well, no, that's fine. You don't have to.
Except for the emergency.
True.
I want them to keep that.
I'm just counting number of votes.
There's some like internal.
I think we need to keep it going, but I don't think we need to.
But I don't see.
Mr. Griffin, what is
Trying to get
this?
you.
You suspect now.
Why is that?
Because he's still up here trying to find it out.
Come on, man, make a decision.
Yeah, I'm just putting just the number of votes.
No, not like this. Not like this.
You know, 10 is our sheet, but she
You
can't.
don't like it, man. You don't like it. You're debating it way too much.
Whatever. Let's move you up. Am I right? Okay then. So you can pay for your house.
All right, well, let's go.
Am I right?
You're the last one.
I'm the last one.
You're the last one.
I'm the only one asking
The other
about
time you would have not hit your gavel by now.
Let's go, Griff. I don't want to gavel you out, man. Uh-oh, what?
Mr. Chairman, order of the day, order of the day.
We
Come
got
on.
it. All right, come on, let's pull it in.
Come on, put it in.
Elaine, you good?
Yeah, just looking.
All right, Michael, go ahead. You're
All right.
Down, Elaine.
So just to summarize where we ended up. So we've got environmental stewardship with 5. This economic development rising MWSBE also has 5. Education has 7.
Yay!
Housing has 4. Health, equity, and wellness has 7. Workforce development, upward mobility, economic mobility has 5, and seniors has 7. So
That's what I'm talking about.
So as a reminder,
Live a long time.
all right, there we go. So 5 was the cutoff for consideration, so that would cause housing to fall off. However, the other 3, 4, 5, 6 would remain.
Right? But right, you got it.
I know.
So
You chopped my head off yesterday. They got me.
So I think right now what we'd like to do is, given the 6 that remain plus the cross-cutting of racial disparities, I wanted to open up the floor again to see if there's anybody that doesn't like any of these, or if the board would like to, I guess, take a straw vote or
No.
make a motion to adopt the.
So moved to adopt.
Second.
You got
All right,
7
move,
over there.
move,
Hold
move.
on, hold on, hold on.
Hold on one second. Moved and properly seconded, but now let's discuss. Michael, tee up what the question of the day is. And this isn't gonna take 3 minutes, guys. I mean, this will take a couple seconds. You say the question.
Sure. So there are a few that seem to have overwhelming support. So seniors and health, equity, and wellness. There are also a few others, which are workforce development, upward mobility. Education also has a fair amount of support, but workforce development, environmental stewardship, and economic development, or rising MWSBE, all have 5. So that is right on our cutoff for consideration. Now, certainly the board could choose to adopt those, or if there's any that you'd like to discuss about falling off, we could certainly do that as well.
George.
I think before we vote, we should ask the manager whether or not she has questions about what the expectations are in any particular category.
Yeah, and I'll just add that the next step of this is defining what success looks like. And so there'll be a chance to talk more about.
Not today.
Oh, yeah, I'm not looking at the time.
Yeah, the next step is the aspirational goal setting for the priorities that we adopt. And so that's where, the manager will have clarity specifically on what we're asking her to do.
I have a question.
Yes, ma'am.
Can somebody articulate what the difference is between this one, Rising NWSBE, and the one down there, Workforce, what else is it?
Upward.
Is it all that, all one lump?
I can do
You just talked about economic mobility is so broad.
The economic development component is different from economic mobility. The development is the investments that we make from, it's the investments that we make from an economic development perspective. It does, it does speak to upward mobility to a degree, but it's different.
So the question is, how is it different than what the Economic Development Committee focuses on?
Okay. We beat this up at length, so, okay. Go ahead, Lee. I'll let you
I think
try
I
to
can,
do it.
I'm going to try to answer the question. I think that the Economic Development Rising NWSBE category is really a focus around land acquisition for the purpose of doing what we do uptown with TIGs and BIPs, but doing it across the county where the market may have less interest, but we as policymakers want to drive outcomes for equity. And so that's not something this board is currently doing. And so that's why we might choose to make it a priority, because it would be novel and really help with our equity goals. Someone correct me if I'm saying it wrong. But
Well,
that's
I wouldn't say land, I wouldn't say land acquisition necessarily.
Yeah,
Let's just say investments, the same way we make economic development
Thank you.
investments. It is a focus in areas that are underinvested.
Thank you.
On the corridors that we're looking at, like I said earlier, corridors outside of Uptown and South End where we get a lot of traffic for people that want us to invest, but they would be areas to spur economic growth. Again, South Boulevard, Central Avenue, Beatties Ford Road, places where smaller developers will go in and help us spur that level of development. It would allow us to have a level of programmatic activity around that.
They
So,
changed the
George and
economic
Susan.
flow.
Okay, so this is the concern I have.
Oh,
Because we asked the question again, what does success look like? You got to figure out how the people who want to develop in those areas approach the board about that. Right now, if a big company wanted to do it, they come through the Economic Development Department or to why could a small company not do the same thing? Why, that's what I'm asking. Why do we have to create something different for small companies or for certain sides of town? Why can't anybody doing anything with economic development come through the Economic Development Committee? That's the question.
Well, I think the policy, and Leslie can help here a lot, but the policy that you have doesn't really lend itself to small businesses because there's a certain amount.
Change the policy.
That's what I'm saying, but that right now, go ahead, Leslie, why don't you talk about it?
No, the county manager's spot on. I think the framework and policy efforts that you currently have leans more into private developers approaching us and informing us about projects. This is changing the lens. It's changing who's driving the conversation, who's starting the conversation. So this would be in instances where you're being more proactive to identify those areas that private developer isn't naturally going to be intentional to invest in communities that otherwise are not being chosen in order to ensure that the residents and neighbors in those spheres of influence of however you draw those boundaries are having equal quality of life, equitable quality of life, access to things that other developers or private developers are only being intentional to put it in certain parts of the community. And I would say that, like, when we had extensive conversations, even like with Daniel Levine, as an example, we said, okay, what would it take for you to say, okay, not just location, but to go to another location and start spurring those conversations to direct investments in places that aren't naturally happening?
So my other concern about that is, since that is not a part of the policy, it means that staff would then have to develop another program for that. And we know that standing up a program can take up to 6 months. And are you saying, let's adopt this, but it'll be 6 months before anybody can get use of it?
That's in the
Yes.
process.
Yes,
Okay.
absolutely, or more. I mean, the program might take
That would be in
a
policy
while to
process.
develop. It could be more than 6 months.
Okay.
In
Absolutely.
policy.
Susan?
I'm super concerned. This makes me feel really cautious because I feel like this is a city responsibility, like placemaking. Like they're the zoning people, they're the development people. I just feel like this is taking the county outside of our scope in a way that I just don't feel comfortable with it. I'm just sorry.
Okay. Yvette?
That's the question that Commissioner Dunlap had. It's like, okay, so if we're going to change who drives it, that's going to require us to go after the small businesses. So we're going to have to issue proposals, RFPs, and all of those things. So that means creating a whole new program. And to address what Susan just said, no, I think that it is definitely, that is our niche, because it is, again, like you said, driving economic mobility. But that's just a piece of it. Yeah, the city has zoning and that kind of thing, but we have our programs too that will help push economic mobility with small Black businesses,
Not just
which
black.
is our priority for racial disparity. It's just another piece of the part of the puzzle. Doesn't mean that we're outside of our domain.
Commissioner Altman?
Yeah, I mean, we have $300 million worth of priorities that we aren't required to do, but we do because we think it'll have a huge impact on the community.
Dr. Johnson, can you, and I'm coming back to you, Susan, in 2 seconds. Can you speak to Commissioner Rodriguez McDowell's lens from your perspective?
So we often are brought to the table on a lot of development projects, and the most recent one that we know of is the Providence Square. And if you had the philosophy that we shouldn't have been in it, then we shouldn't have been in that one, right? So we're in, and I'm not saying that you're saying that, I'm just saying, so we're always in those development conversations. And in many of those instances, when those occur, the public-private partnership becomes heavily weighed on the county to help that public-private partnership because it's relying on property tax dollars to bridge those gaps. And so when this board decided to put more emphasis on our efforts for economic development, it was intentional to say there's instances where we're putting more money on the table, so the county should lead more heavily in those conversations than just being, you know, they wanted to be driving the car in the front seat of the car, but not in the back seat of the car. So that's how Mecklenburg County over the years has slowly leaned more into economic development. The second thing that I would share is, yes, the city does do things, but economic development team and the thought process is more than the city of Charlotte. It includes the towns. So the city of Charlotte is only going to focus in on corridors of opportunity. And I would probably say if you drive around Mecklenburg County and/or the city of Charlotte solely, there are more areas that have the opportunity to be reinvested in than just the corridors opportunity. Just like we have done some complementary work to go with affordable housing. So it's to what degree do you feel like this board should be invested in doing complementary work to bridge gaps in our community, or if you think it solely resides with one entity? And I can give numerous examples where you as a board have chosen to lean in over and beyond whatever you think is the lane of requirement. And it's your personal choice. I'm not going to say one way or the other, but I would just say that there are numerous examples where this board supports financially other things that you may not have to support, but you think there are priorities and you make additional investments in it.
Yeah, so thank you, because that's exactly what my lens is, that we already do that. And we're like Bobby Drakeford's project, you know, like when things come up, we do want to be a part of them. You know, we do see those opportunities and we take them. But do we want to be the ones going out and saying, this is now our domain, we're going to go out and place make?
It wouldn't be so, but let me just give this one last thing. And again, I respect your opinion. So just please note that I'm just giving
Speak to the
context and
mic.
I'm not trying to take away. But you brought up the Bobby Drakeford one. That was a hard one to make
Yes.
happen.
Yes.
And that's because the toolbox that we typically use for the other side's developments that happen in other parts of the town, the incentive that we use to make that happen looks at the change in value of that development. So typically, it has to be big-sized developments in order to yield that delta in order for us to give them a grant recipient back after they make their payment of the taxes. If you have a mid-sized development or a small-sized development, that change in value isn't that significant. So that's why those don't naturally come to us. Do you think most of the ones that come naturally to us in economic development tend to either be in certain parts of town and the certain scope and size that change in value is significant enough? And this would be, I guess, in concept, trying to figure out what strategies can we employ to try to get more Bobby Drakeford-like projects in parts of community that others aren't considering, and that value may not be as substantial. I think that's the intent of what I'm hearing from
Well,
the chair.
that's spot on, Les. Because here's the thing, are only certain developers going to be able to provide assistance? Like, a lot of times we're having these conversations, we're wondering why certain parts of town that we've been driving through for 30 years have not substantially changed, significantly
That's right.
changed.
That's right.
And it's due to the lack of the underinvestment, because if I'm a big fish, I'm not gonna play in that little pond. I'm just not going to do it. And so how do we get to, Bobby is probably the only example that we have of a medium-sized fish where we worked a deal to make it happen in that area. I can't think of another, since I've been sitting on economic development for 6 years, I can't think of another smaller developer who wants to play in that space where they've had an opportunity to get some level of assistance. Now, if the argument is, hey, we shouldn't necessarily go out, I'll say that's fair. But what happens when they're coming to us? Hey, I see this space that I would like to develop and get some assistance with. Well, I'm sorry, we don't have any tools in the toolbox, but if you were a $200 million a year company, then we could help you.
Okay,
You see what I'm saying? So if you don't want to go out, I'm fine, I would concede that. But when they come in, can we expand the toolbox to say, yes, we have some tools that could potentially help spur investment and do our evaluations like we do. Now, it may not be the same level of REMI model. But there can be an evaluation, because now, when we think about the dollars, if we can get investment in underinvested areas, we do get, to George's point earlier, a return.
I support what you're saying, the idea of having more tools in our toolbox for sure. You know, I think my unreadiness is in, like, us taking that on as a let's go out and start, you know, trying to spur development, you know. But I love the idea of having more tools in the toolbox.
Sure, I'll give one additional clarification point.
We can't hear you over here.
Sure thing, I'll give an additional clarifying point. It could be, like I said, I had a conversation with Daniel Levine, help us understand what would it be to make you have attraction to go to another area. So those conversations can happen, but it's not solely that. What it is, and staff are starting to do assessment and trying to understand where are the potential areas. I mean, we all anecdotally know, but you know, you hear the city has the corridors of opportunity. If you invest in the corridors of opportunity, then you get X, Y, Z, and a B, whatever it is. We're trying to say it's more than the corridors of opportunity. So can we define areas that we know? And it may be we're taking the lead by defining the area, and then developer comes in there. So it's just like when we have sometimes with our business incentive grants, if a business chooses to locate in a certain area, they get a different percentage of an incentive. That's not always attractive, but it exists. So it's how do we create those same types of
incentives to attract in areas that aren't naturally happening because financially it may not be attractive. They may just decide that, because it's from a private sector, they're choosing to invest where they're going to get the greatest return. And sometimes they may not feel they're going to get the greatest return in some of the areas that we knowingly need help. So that's all.
Okay. So as far as the budget conversation goes, we're talking about putting dollars into the budget to be able to have people do that work to create the tools in the toolbox? Is that?
That's not what my intention is, necessarily to have people create the tools in the toolbox. My intention would be, just like we provide a level of incentive for people that come in now today for a level of investment, when they have a deal, they come to us. All I'm saying is, if you're a smaller developer, right, you're a smaller developer willing to go into underinvested areas, we will have, there's dollars that we could put to help with that investment. Our staff can develop the mechanism to make that happen.
So it doesn't necessarily pay itself back like the ones that we have now, where the REMI model shows we're not underwater. You're talking about we could be underwater, and we have a fund for that to cover the underwater part. Is that what you're saying?
No.
I'm sorry, I'm not trying to be difficult. I'm just trying to understand.
I guess I'm applying it the same way we do now. The same way we do now, but it's just a mechanism for smaller developers. So the REMI model would play out if that's the case, but I mean, I think the REMI model would have to be equitable as well, right? It's not gonna be, it's gonna be commensurate with your risk in the areas that you're going to. So what if it doesn't, what if the return of 2 million doesn't play out over 10 years? What if it plays out over 20? Because that area has to be developed, it takes a longer time to turn that area. You know, there are just things, there are other factors that we would have to go into, but an equitable lens would have to be applied to it.
Sure.
But we would be getting a return on investment.
Okay. I'm totally cool with this. I just want to make sure, maybe offline or later on, someone can help me understand how does that work into the budget? Like, I don't understand where the dollars, exactly go.
Okay.
So
Well,
maybe we could talk about it later.
Yes, Les.
The one last thing that I will just say is, I understand or appreciate you asking what I'm going to call the details of the question, because it's helping you to understand, because some people can work in concept and some people need a little bit more meat to better lean in to understand what what is trying to be achieved. What I will note is, I'm going to use the revolving loan as an example, the MEC lending. The Board of County Commissioners, through studies and information, eventually elevated and said, not for a board priority like this, we want to make an investment, or we want to make a difference in having small business have access to capital.
Right.
And from there, staff then went behind the curtain, tried to figure out what we could come up, strategized, made proposals, and presented to the Economic Development Committee. Of course, it got also presented to the executive team to make sure whatever was being presented was a viable solution to solve to that goal. That would, if this rises up to be a priority, that same kind of a process would happen. So what would happen is the team would start coming up with different types of strategic solutions that will get to that end. It would be shared with the executive team to make sure could it be financially achieved, can it work, and the like, and then eventually will also be vetted with the Economic Development Committee to have an understanding of what it is, so it could be either an endorsed tool to be in the toolkit or not. So some of those nuances that I think that you're wanting to see won't show up until this becomes something that the board wants us to do. If the board doesn't want us to do it, then we're not going to have all of those deets ready for you at this time.
Thank you.
All right, so there was a motion on the floor. What was the questions that you had us talk, that you asked?
Yeah, what's the
So,
Please go back.
actually, I'm going to ask Mike to maybe switch this over.
It's time to play.
No idea.
So these are the priorities as we've heard them. And so this will help tee us up for the next session. But before we get there, I wanted to have a check-in and see if this is correct. So this is what we as staff have heard, that the board priorities are health, equity, and wellness, education, seniors, workforce development, and economic mobility, environmental stewardship, economic development, and WSBE, with racial disparities as a cross-cutting. So I believe that was the question, is just confirming that this is correct. And if so, our next step would be just a short break, and then we would come back for the next session.
Sounds good to me.
I can live with it.
All right, all those in favor say, let's see by show of hands. All
Are we
those-
not absorbing for a minute?
You're not absorbing.
These are the board
You
priorities.
need time to absorb, I mean,
I want to absorb.
There's
I don't,
Count this way, please.
what's the unreadiness?
oh, no, it's just,
The same people,
I am.
I just think
same
we're
argument.
taking
All
two
right,
spots.
all those in favor say aye.
Aye.
Opposed? Ayes have it.
It's unanimous, right?
I think
Move to adjourn.
we're taking.
We're not gonna adjourn.
Slot.
Listen, we have one more session. We're
But you holding
we're
us up?
scheduled not, we're scheduled to leave at 4 o'clock.
Like that city.
Oh, I thought you said 3:30.
No, ma'am, no, ma'am.
sorry.
No, that's okay, that's okay. We're scheduled to leave at 4 o'clock.
I'm not happy.
So we'll take a
I'm not
break.
happy with this. I
We'll
should have voted
we'll take a
no.
break till 2:45.
Thank you.
All righty.
What did he say, 2:45?
Is that
Perfect.
perfect? Yeah.
Yeah.
All right, team, I see everybody making their way. So,
Okay. It's in creating
is that Joe Bruno?
No.
Okay. All right, this is the last portion. So here's what we're gonna do, guys. We have the board priorities on the screen. Essentially, there are basically, even though it's worded differently, there are two new priorities, or two priorities that are different: seniors and the economic development / MWSBE. We have one more exercise for the afternoon. And what staff is going to do, and so Commissioner Griffin, I know the aspirational, the specific goal setting was important to you. But what we're going to do is, we're going to have staff go back and react to these priorities, tell us what they think that they can do, where we can get some lift, and then we'll come back and set the aspirational goals. Everybody tracking?
You mean on another day
On another day.
or 5 o'clock tonight?
No.
On another day, on another day. So here's how we're going to wrap today.
Okay.
Michael is asking us to provide any final thoughts around what we have here. If you want to set aspirational context, if you want to specify what we'd like to achieve in a particular category, you can do that. You will only have 3 minutes to do that, and then you can send an email if you go past that. But I think we've had a tremendous amount of discussion. It's been positive, and I appreciate it. Anything you want to add?
No, I think that'll be helpful. So based on the feedback that we received from you here as we wrap up, like Commissioner Durrell said, we will go back, work with departments, and then come back to you at a public policy meeting in February. And I have a slide that'll speak to that as I wrap up towards the end.
All right. Let's start with Commissioner Leek. Any thoughts on priorities and things you want to say?
They are as they are, and we voted. And I'm sticking with what I see on the screen, and I don't want anybody to change what we've decided we're going to do. That's a must. And this is what we're going to say to the public, that these are the areas of concentration that we feel that we can make a major difference in the lives of the people of our districts and of the county of Mecklenburg. Now, somebody else may want to stir the pot another way, but I would hope not, because documented is what we have here, and that's what we're going to go back and talk about and share with the public, and not keep it a secret. So I'm just excited and happy that I'm here to participate, and that the senior citizens have become a major concern for this community. And I'm grateful to this board, especially for stepping to the plate to say you have a place in this community, and we care about you and not play with you, because we are valuable. We make the decisions. One we made was voting for Trump. That's the one major one people made, not senior citizens. But I'm grateful to be here and be a part of this, but don't change it. And you keep coming back, talking about it, so I want to make sure we take a picture of everything up here, so that when you all get together, 4 or 5 of you, you're not going to change what we have up here. Thank you, Mr. Chairman.
You're welcome. Thank you,
And thank you
Commissioner.
for your leadership.
Thank you. Commissioner Townsend Ingram.
Yeah, the two that are really sincerely important to me are the health, equity, and wellness, and the seniors. And seniors, there's going to be a lot that falls under health, equity, and wellness.
That's
If that makes any sense. Because there's so much that we have to do with them, and that includes housing, it includes all of the other little small things that we kind of narrowed down. The health, equity, and awareness also in particular is the food insecurity, because I think that that's something that should be a no-brainer. Housing, I know we eliminated that, but housing and something to eat, it's just, they're two things that I think that we just really have to focus on
City Council.
in particular, because without those things, you can't do education. Kids can't get an education. You can't get anything else right if you don't have your basic needs met. So narrowing down that focus for our community is really important to me as the new kid, the one person I want to be on the board and focus on.
Thank you. Commissioner Powell.
I really just want to say they're all really important priorities. I'm glad that we came up with this and we all agree on them. And just encourage everyone, like if there's a bucket that you're less fond of, meet with each other. Like we all need to meet with each other and talk about why it's so important, because the more we talk, the more we understand. And so, you know, I only got 5 dots for environmental stewardship, but I know that 9 of us voted yes. And so if you have questions about that, I'm happy to meet with anyone. And then, you know, if I have questions about something that is, you know, other people are really passionate about, I will go to them. I just want to encourage more conversation between each other, because I think everyone here cares deeply about all of these priorities. Thank you.
Commissioner Griffin, thank you.
Thank you, Mr. Chairman. And Elaine, I'll take you up on your invitation to learn more about environmental stewardship. I pledge to do that because health equity and having a park or a trail to walk on is all connected. So I'll talk to you more often. Starting at the bottom, MWSBE, a policy would be great, and a cost. The manager always asks, what does it mean for me? What is a cost in technology to be able to understand what the spend is like throughout the enterprise? The workforce development, I'll get with you, Elaine. It's not just you, but I also will get with the manager and see if I can articulate better what that workforce development looks like in terms of what's not happening today, because I have talked long conversations with Anna London, and I served on your behalf as a trustee at Central Piedmont to understand what we were doing there and what was happening for people who were trying to get a better job, but there was a little small skill deficit that we never figured out how to manage. A skills deficit that we never really figured out how to address at Central Piedmont, and I think that was just results of not having 5 votes. Education, we got to know if our kids are going to CMS ready for kindergarten. I think that's just an imperative. So that's my 2 cents, Mr. Chairman, and to Michael on that list, and I'll put something in writing to you subsequently.
Thank you. Commissioner Rodriguez-McDowell.
Thank you, Mr. Chairman. Yeah, I think the key to this is, you know, kind of what comes under these headings. And I think, you know, for example, child care is a massive problem. And, you know, I think it falls under economic mobility. It also falls under education, you know. So I think, you know, the proof is going to be kind of in the pudding, so to speak, like how these things, how the sort of sub headings or whatever. I think, you know, for me, that's a big, important one. I think I really am a little bit worried about the prenatal to 5 coming off. I hope that's going to stay. I don't know if that means it's under education now, or if it's, yeah, I mean, I think it depends on where some of our things are that I believe are really important. And if we're baselining them, you know, I'm okay with that as long as, you know, they're still there and they're still important and stuff like that. So I think it's all going to be in how it shakes out, but
That's fair.
yeah, that's my feedback.
Yeah, that's fair. Commissioner Dunlap?
I'll use my time to focus on two particular areas. Those are the new areas that have been added to our priorities as it relates to seniors. What I hope to see is some recommendations based on the comments that we've heard recently about how to expand services, particularly daycare services, whether or not there are additional food services need, health and wellness, whether or not there's additional service that we can provide with critical home repair and expand beyond just the house itself, but maybe the property within reason, helping to provide opportunities to age in place, and figure out some way to measure those things. And as it relates to economic development, MWSBE, it's the opportunity for smaller businesses and organizations to get a TIG or some kind of assistance to help with development, and just be able to do economic development on a smaller scale from smaller vendors.
Thank you. Commissioner Meyer?
Thank you. I'm really excited for some of these health equity, education, seniors, environmental stewardship. What's on my mind is mostly we've lost housing. And really that's under economic mobility. So like Susan said, it's what's going to come out in the end and how this is all going to play out. So I think staff has a challenge ahead of them. And I appreciate y'all immensely. Thank you.
Commissioner Altman?
Thank you, Mr. Chairman. I think we're really lucky to not only at this moment in time when we're encountering an economic slowdown, that we have the benefit of our manager who has such deep knowledge about all of our programmatic, all of our programs and all the people and entities we fund. So lucky that before she leaves us, that she can operationalize that body of knowledge to help us make wise decisions and how to be as lean and as effective as possible. It's just a gift that we have you on board to do that for us as one of your final acts. And I don't think we're going to lose affordable housing. I think that we will continue to fund it in smart ways where we can be value add. That's what we've been doing all along. I want to be clear, I'm so grateful to Anna London. She has only been in the role about 2 years, I think. She's very smart and really helping us with that part of our work of our labor market. But I'm excited that talent pipeline, workforce development continued to be a priority because I really think that this board has made a difference in the conversation over the last 4 years. I think certain important work has been accelerated because of our focus and the pressure that we brought to bear. And I think that we can really, and we're an important funder. We're an important part of the ecosystem. So I'm not trying for us to fix it. I'm trying for us to help provide leadership with our other partners, especially when it's not real clear to me that there's anyone driving the train to adjust strategic planning community-wide to meet evolving needs. I don't know that it's clear that there's anyone owning strategy at all for formation of a talent pipeline. So these are the kinds of things that I hope we can get our resident expert, the best we can find, to come in and help us drive leadership in the community with our critical partners. And look forward to all these other wonderful priorities, all of which I deeply believe in. Thank you, Mr. Chairman.
Thank you. Thank you all for your comments. And one of the goals that we wanted to, and I talked to the manager about this, but, I wanted this retreat to have a really deep level of discussion. I wanted us to be able to speak to one another and to really have a robust conversation so that we understood exactly where we were beyond just 3 minutes or whatever the time frame that might have been set. And I feel like we've accomplished that. I loved our previous priorities, and frankly, I love the buckets that we have on the board. Yes, I lost out on housing. Many of you know that's near and dear to my heart, like Commissioner Meyer. But with that being said, I love the priorities that are here. I love that, again, we're going to apply this lens of reducing racial disparities. I think when I look at the 4 buckets, we certainly already have a lot of this baked, in my opinion. When I look at health equity and wellness, I'm looking cradle to grave, right? So to Commissioner Rodriguez-McDowell's point with, the prenatal aspect, as we look at health, certainly I'm looking at cradle to grave. With education, my focus and what I would like staff to evaluate is, how do our dollars contribute to reducing the disparities that we saw on the slides that were presented? If it's just funding, then fully fund, or if there are other programmatic efforts that we can fund, supplemental types of support, I would like to look at that. Also, with respect to seniors, looking at expanding adult daycare, to Commissioner Dunlap's point, and also understanding that we have active seniors, and what sort of programming activities can we invest in, and what should the future look like there. Workforce, we already have that sort of built out. Commissioner Altman has talked about that. And environmental stewardship, I think that's already baked. And with economic development, I think we've got a clear focus on, we're talking about the smaller developers. So I don't necessarily see a heavy lift. And when it gets back to us, I think we should be able to apply some level of aspirational goals, whether that's dollars or percentages. And certainly, Commissioner Griffin, MWSBE, that policy is also being baked. But these are just important for the community to know that this is where we want to focus on, and anything that we may have lost as far as priority will still be something that we'll keep in the forefront of our minds. Our housing bucket doesn't go away or anything else. But I appreciate the effort from everyone as it relates to this, and I hope I was able to give some direction on what my thoughts are with respect to the buckets.
Thank you. So I'll actually ask our tech staff if we could switch back to the other deck real quick. Skip this because we just did that. All right, so before I close out, just wanted to give you a summary of what we've done and our next steps. So over the past 2 days, we identified strengths, opportunities, and challenges, identified the priority areas today. We've discussed kind of what these priority areas mean to you, what the focus areas are, what we should focus on, and how we might start to define success. So in terms of next steps, myself and my team, we're going to send a summary of these draft priorities out to you all. So we'll make sure that we get this out to you by Monday. We're then going to take your input and facilitate additional conversations, certainly with the manager, her executive team, the department directors, and other county subject matter experts. And then we will bring back a proposed slate of board priorities, descriptions, focus areas, success indicators, all of that additional information so that we can have that aspirational goal conversation. We'll bring that back to you in February. So, Mr. Chair, that's all I have today.
Commissioner Powell.
So you call them draft priorities, but they're real priorities because we just voted.
That's correct.
Okay. Just want to make sure.
Absolutely.
I took pictures.
That is correct. They are the priorities. Other things will be the draft.
Thank you.
Absolutely.
All right.
That's all I have.
All right. Thank you, Michael. Thank you, Julia. Let's give it up for Michael and Julia. And great job. And while we're doing that, let's give it up for our entire staff. Thank you so much. And with that said, we'll turn it over to the manager for final thoughts and comments.
Final thoughts and comments. Well, I thought this was an awesome retreat. I really appreciate all the feedback that you gave us. I thought it was a great dialogue, and I appreciate the leadership of Chair Jarrell and Vice Chair Altman to really force us to think differently about the retreat. I think it was a really great outcome. I think the community would be really proud of the work that you've done over the last 3 days, and so it makes my heart full to be able to leave you in such a good place. I do want to also thank the Office of Management and Budget team. They're awesome. They're chomping at the bit to go cut stuff, so we're excited about that. Office of Strategy Innovation as well did a great job on your priority setting. And, of course, our production team,
Yes.
our mighty production team in the back.
Yes.
who come up early and stay late to make sure that the community gets an opportunity to look at the work that you're doing. And of course, the executive team and David and Suzette, who have been here the whole time as well. Thank you for your support. And look forward to going back and putting some good things together for you to think about as you move into FY26. So thank you.
Thank you, thank you. So we'll entertain a motion to adjourn.
But can't we get PI to play the video again for Dina?
No.
Oh, it's so good. No.
It was running through the background. We'll share it.
Like Monday.
All right.
Okay.
Sounds good.
Facebook Monday.
All right, we got a motion and a second. All those in favor say aye.
Aye.
Opposed, ayes have it, meeting adjourned. Be safe travels, everybody.